fight. We don't have to kill. Everybody in the whole wide world really just needs to chill. No, we don't have to fuss, no, we don't have to fight.
Hello, everybody. Welcome back to another episode of Just Chill with Oliver George. This is episode number 63, and I am sitting across from a man with some crazy credentials that I can't wait to talk about. I don't mean crazy in a bad way, like crazy impressive. But before we get into that, I want to remind you, if you're watching on YouTube right now and you would prefer an audio-only version, you can get that on Spotify, Apple Podcast, iHeartRadio, and many other places like that. If you're listening on one of those right now and you didn't know there was a visual side to this thing, then please come check it out here on YouTube. While you're there, if you could subscribe, it would really mean a lot to me. We recently hit 1,000 subscribers, and it does warm my heart, so thank you if you've supported the show in any way. If you want to contact me, you can hit me up at justchillpodcasting@gmail.com. While you're there, let me know if you're interested in one of these stickers. I recently got an email from a fan of the show in Dublin, Ireland, Gary Cunningham. Shout out to you. He's a super supportive dude, so you've got some of these coming to you, man. That's it. Am I forgetting anything? I don't think so. Fuck Mike's Hard Lemonade. We'll throw that in. But let's get to the guest, the man of the hour, Dr. Matthew Buchanan.
Fuck Mike's Hard Lemonade.
Thank you. Yeah, I'm hoping some guests will join in. Yeah, I'll tell you more about it after the show.
Yeah, thanks for having me, man. I appreciate it.
I didn't know if I should include Derrick, because I've seen both when I'm reading about stuff of yours online. What is your preferred title?
Yeah, I mean, so that's an interesting question, actually. Like, academically, I do use, like, my whole name. My first name is technically Derrick Matthew Buchanan, or, like, that's my whole name.
But for this podcast.
And for this, like, for comedy purposes and stuff, and my whole life I've grown up, everybody always called me Matthew by my second name. It's like a family thing. We go by our second name.
Okay.
And, yeah, so pretty much everybody on my family on my dad's side, we go by our second name, and we all have, like, four or more, like, lots of names and stuff. And but I made the decision, like, I don't know, once I really started my academic career, to go by, Derrick or Derrick Matthew, from the point of view of when I'm doing, like, my academic, when I'm publishing, when I'm writing and stuff like that. And then, like, I guess you could call my stage name, my comedy name,
just
which
to
is
differentiate,
also call me. Yeah, because really it's like, if you're, if from like a work point of view, if you're interviewing me, or like I'm a candidate for some position, I don't want people to necessarily find all my comedy stuff when they're looking for my science stuff. So I've, like, kind of used that distinction. So if you search, Derrick Matthew Buchanan, you'll mostly find things related to my science. If you search Matt Buchanan, you're going to find all my comedy stuff. So yeah,
I asked because my son, he'll add your name graphically after. So maybe we'll do both. We'll do Matthew Buchanan rather, comedy, and then Dr. Derrick Matthew Buchanan, PhD, can pop up after that for all the science-related stuff.
That's nice. Yeah, you did get the whole title in there. Appreciate it.
Yeah, man. Well, first of all, congrats on all your recent life developments. You're only a few days away from heading off to California to do your, I want to get this right, postdoctoral research fellowship.
That's right.
At Stanford. Everyone knows Stanford. That's super impressive. Are you excited?
Man. Oh, fuck yeah. Yeah. No, I'm really excited for that. I mean, it's been a lot to get done in the last, like, couple of months. Like, I only found out, I mean, it took me like 6 interviews, and, like, this whole international competition started, early summer, and then found out probably late July that I actually got the position.
Wow.
And then now
that must have been kind of grueling while you're waiting.
Yeah, man. And, like, I kept telling them, like, I was really hoping I would know sooner, and then I wanted to know by, like, Canada Day, and then I probably didn't find out till, like, late July that I was officially got it, and then it was like, hey, I got, like, a month and a half now to leave.
Well, to uproot your whole life, that's not a small thing. We should say why you're going there. Just sort of your field of study. You are, again, I want to get this right, I specified clinical, because a clinical PhD neuroscientist.
That's right.
And you've had some training at Harvard, some at McGill. Did I read right that you did some in Europe?
Yeah, I did. You must have checked my LinkedIn or something.
Hey, man, I try to dig deep.
That's good. No, I appreciate it. That's some good research on your end. You got very thorough looking notes there too.
Yeah, they're kind of sloppy looking in another regard. Looks like a grade 8 student.
As long as it works for you, but
I do pictures sometimes.
Yes, that's right. So I do have training at Harvard, which is sort of like to my specialty. Like, I went to Harvard in 2015 to get a certification for my specific techniques that I work on, basically, because at the time there wasn't really anywhere that you could actually get trained on that in Ottawa. It's like a pretty new type of technique involving brain stimulation and stuff. And I got my PhD and did work. I have certificates from McGill as well. Did a fellowship in Geneva for several years.
That's what I thought it was.
Yeah, that was
so cool.
Kind of through like work stuff that I developed out here. We published some papers together with them. It was a neurology lab out there. That was on a scholarship too that I got. That's like a international scholarship called the Think Swiss Scholarship that like basically the Canadian, American, Swiss embassies every year have this scholarship that you can apply for that like sponsors Canadian and American students to go to Switzerland to foster new collaborations and that sort of thing.
Wow, that's so awesome.
Yeah, it was pretty awesome. It was, I mean, that was a great experience. That was in 2018, and basically spent a semester there working out of this lab, getting that kind of mentorship. And then while I was there, I also got to travel like a lot. So, I mean, I think I went to more than 10 countries in the like 4 months I was there, just all around Europe, pretty much, like seeing everything that I could see. Every weekend I would just go somewhere because like it's all so cheap and like nice.
And Europe's so close together,
exactly,
comparatively.
You take a train somewhere, you take whatever. Like if I was in Geneva, but I could like see France from my window, kind of thing, like parts of France. And there was a mountain in France out there that I could see out of my window actually. From my apartment in Geneva. And I remember looking at that mountain every day, and then I was like, man, I want to like just climb it. It'd be nice. And then I found out you could jump off it. And so I went and did paragliding off that mountain too.
Holy hell. Do you have video or anything of that?
I do actually, yeah. I have
man.
like a couple clips somewhere of me like in the air flying.
If you send it to me, I'll put it up.
Lap.
I'll cut the combo and put this up so
nice.
people can see.
I could send like a short clip of that. It's just like me super stoked out of my mind. And then the guy's like, I don't know, doing his colloquial jargon talk of, do you like chocolate? We have good chocolate in Switzerland.
Trying to keep you calm.
Yeah, I was like, he kept saying too, because like I'm a big dude, right? And he kept saying, he's like, well, we're losing altitude quickly. We're going down a lot faster than usual, because they like kind of promise that when you go for this, that it's going to be like a 20-minute, you get to flow for 20 minutes. He's like, we're going down a lot quicker. He's like, it's okay. He literally, no joke, we went down. I mean, say it's supposed to be 20 minutes. We were probably down in 12 minutes, and he literally we're in the air, and he's like negotiating a discount with me. He's like, we'll give you 25% off. We'll give you a refund for a bit. And I was like, sweet, man. I was having such a good time. I was like, oh, fuck, take my money, man. This is great. But
Okay, Mathieu, it was a short flight, but a really nice flight. Thank you to fly with Paradelta. Maybe see you next time. Absolutely. Okay. Woo! See you, bye-bye.
This should be a bit for sure. If it's
I've never even thought about it.
Oh man,
right
that's
now.
hilarious. It actually, as you're describing it, it sounds like something that would happen to Homer Simpson. How he got stuck on the water slide.
Oh yeah. I've almost
so funny.
Calypso here. Me and my buddy, like we came closer to the edge than I think was very safe to do. Like the lifeguard, like the one that's like a half pipe.
Yeah.
In the kids section actually too, because we went in there like only 2 of us on it, and I think the limit was 400 pounds, and we were definitely close to 500 pounds. And the lifeguard like stood up. She was like, I've never seen somebody get that close to the edge. And I was like, God. Yeah, I don't want to ever do that again.
Well, Calypso has had quite a few lawsuits, if I remember correctly, that there's been some people permanently injured. I think they even had someone die there. I don't know if you can remember that. But anyways, you'll notice I throw to my dad for fact checking.
Nice.
Even though he has not really the ability to Google things because he's too busy switching cams and monitoring everything else. But he just generally knows a lot of shit. So. Mm-hmm. Well, man, I want to talk to you about your field of study because again, a lot of this was over my head. I tried reading some of the papers. Some of them I got more than others, but I did gather that your focus is this transcranial. Again, I'm going to check my notes. I want to pronounce it right here. Transcranial direct current stimulation.
That's right. Yeah.
So this is like shock therapy in the layman's terms to some degree.
Yeah. I would say yes. Totally, but at the same time, I'm the scientist in me forces me to correct people when they say things like that. Only because
please do.
The idea or like the terminology shock therapy, I feel is stigmatized a bit, which is why I correct it, because technically it doesn't fall under that category. Like the one when people think of shock therapy is usually more referring to something called electroconvulsive therapy. That's the one where you put the big coils up to the head, the one you see in movies. Yeah, exactly. That's the only one you ever see in movies that's like this. I don't think there's any movie that's ever had a direct current stimulation device in it or a magnetic stimulation. It's always like the big one. And usually it's used for things like people who have like very, very severe treatment resistant depression, or people who have like epilepsy, people who have schizophrenia, that sort of thing, which is why I think historically in movies, it's created a negative stigma surrounding it. So in current terminology, I mean, it's I guess you could say we've canceled that terminology. We
I get it. If there's those negative connotations.
Exactly.
Yeah.
So we try to refer to it in a more scientific light, so that it doesn't give people that negative feeling about it, like that type of connotation when they are thinking about it, especially when it comes to, you know, having new patients come in, and like you don't want them to think about it or feel stigmatized when they're getting it. And so all this is to say that one that you would traditionally have maybe heard the terminology like shock therapy is more electroconvulsive therapy, or ECT, which comparatively to what I do, where I've spent a lot of time on, is transcranial direct current stimulation. The short form for that is TDCS, just in case I use that terminology so it doesn't.
Yeah, I had that here too. TDCS.
It saves time when it's a long
Yeah.
term. And so I'll break that down for you. Basically, transcranial direct current stimulation, word by word. So transcranial means like across the scalp. So trans, like Trans-Canada Highway, it's across Canada. Transcranial meaning across the cranium. So we're sending electricity across the brain. Direct current is DC. So everyone's probably familiar with the band AC/DC, or maybe, you know, Edison and Tesla, right? You've got So you've got AC and DC current. They're different types of electricity, and they're different types of brain stimulation that you can use. And you can use direct current stimulation on the brain. You can use alternating current stimulation on the brain. And there's different reasons why you would use each of them. But mainly direct current, what it's doing is basically injecting direct current into the brain. And it's all non-invasive, which means it doesn't involve surgery. It's all topical. Like there is literally TDCS devices built into headphones, much like what we're wearing. Like imagine you just had two electrodes inserted underneath this cushion of the headphones. That is something that you would...
Would this be painful?
Typically, it's considered to be painless, but there are some people who experience like some degree of pain to it. So, like let's say on a scale from 1 to 5, some people might say that it's like painful at like a 1. You know, like a
so
very
more
mild.
of an annoyance.
Yeah. So most people describe it more as being itchy or tingly, or like pinpricks, like needles or pinpricks kind of thing. Like if your
foot falls asleep.
Exactly, that sort of thing. So it's generally not described as painful, but more so in that light. And the idea really is that, okay, you've got, when you think about mental health or neurological conditions, most of the time people will think about them in the light of some brain region is not active enough, or another brain region is too active, right? Like that makes sense. So part of your brain's doing too much, or another part of your brain's not doing enough. And because of that, you're having these symptoms that make you feel a certain way. And that's what leads to a particular mental health condition, neurological condition, or so on. So basically, we use this direct current stimulation, which involves typically 2 different electrodes, a positive electrode and a negative electrode. And you can choose where you put them on the head in order to choose which brain region you're trying to manipulate. And in basic terms, wherever you put the positive one, it's going to pull positive ions that way. And wherever you put the negative one, it's going to pull negative ions that way. So you can introduce more negative electricity to one part of the brain, or positive electricity. And since our brain is ultimately an electrical chemical system, when we pull the positive ions one way, it increases the excitability of that brain region. So it increases that activity. So if we know that a particular brain region is underactive, or in scientific terms we call it hypoactive, then we would introduce positive current to that area, and you can basically boost the activity in that region. Or conversely, if you have part of your brain that is not active enough, or rather it's too active, it's hyperactive, then we introduce a negative current to that part of the brain, and it's very low milliamps. So again, comparing that to something like ECT, electroconvulsive therapy, it's about like 1,000 times less of a current that's actually used. So I believe most cell phone batteries are like around 800 milliamps. I might be wrong on that. I'm trying to remember from a lecture slide that I've given before.
Yeah, no.
I think it's around 800. And TDCS, direct current stimulation, usually you max out at 2 milliamps.
Okay.
So it's a very mild current that we actually introduce into the brain.
Difference.
Yeah, very big difference. And really what it's doing is just kind of modulating brain activity in a very particular region. And the thing is, if you do that once, like to actually treat somebody with it, you would maybe do 20 sessions of it. So you would do, say, 20 minutes a day for 5 days a week for 4 weeks. And once you've done that, then it can kind of achieve what's called a neuroplastic change. So you can change the brain with one session, and that might last an hour or two. But if you want to change the brain like permanently, in other words, like getting more towards like a cure for a disease.
This was going to be my next question, yeah.
That it kind of gets into a more permanent change, yeah.
I would be interested to see if that would work well in conjunction with a lot of the stuff I've heard about psychedelic mushrooms and neurogenesis and being able to essentially grow the brain in new areas and stuff. So I would wonder if those would be combined, if that would see any success.
Yeah, no, that's a great point. I think whether it's mushrooms, ibogaine, ayahuasca, LSD, or traditional pharmaceuticals, SSRIs,
ketamine, they use them.
It doesn't really, basically TDCS, direct current stimulation, is regularly used as like an adjunct treatment, which means like, it's like an add-on. You can use it on its own, but it does actually work quite well with these other treatments. And there's a lot of good research that demonstrates like if you combine them, you get a better effect than using one or the other. So by using both, you get aggregate effects.
Which makes perfect sense.
Exactly. Yeah. So it's...
well, I noticed in one of the papers that you guys were, it seemed like trying to prove that this would be a viable option to use for ADHD in children.
Yeah.
Because again, with those negative associations people have with shock therapy, I could see why people would maybe not want to sign their kids up for that. So you guys are trying to disprove some of those, horrible stigmas, as you were saying.
Yeah, no, exactly. So we started off with this idea that it's probably, pretty much any mental health or neurological condition you can think of, it's been tried in like now as of 2021, like anything, ADHD, OCD, depression, anxiety, Parkinson's, stroke, like anything you could think of, I guarantee you'd find a paper that has investigated that. But where we came in, this started in like 2015, and this technique really only emerged in 2010 or so. I guess it only emerged in children in 2011, but it started emerging maybe a little bit like closer to like 2001 in adults.
Okay.
And then we started our major trials in 2014, 2015, and that was in pediatrics and kids, because up until that point, and even still now, if you were to look at like, there's probably been maybe a few thousand papers, probably no more than like 10,000 articles that have been published on this in scientific literature since 2000. And like 95% of those articles are in adult groups. So only like 5% of all the research, actually less than 5% that's been done, was in kids. And so
super minimal. Yeah. It's
really small amount of that. And so like there's only a handful of groups even around the world that actually have done pediatric or childhood direct current stimulation. And so we were sort of pioneering that through the Children's Hospital, doing that work because we were hoping, and based on a lot of the research we read, it seemed like it could be very effective in treating ADHD. So the idea was let's try to see if we can apply that. But then even in doing so, like you said, there was so much stigma around it that it was difficult to recruit people, for instance. So we ended up having more than 30 children participate in our study, and that was a good number for us in general. Like that's what we were aiming for, but it took us several years even just to get that many. And you can imagine, I guess, like if you're a parent and you've never heard of this, and somebody approaches you and you say, "Hey, can I
put a big magnet next to your kid's head?
Can I do that?" And they're like, "Well, what are they have a lot of questions, right?
Yeah.
What is it fine? Is it safe? Is it
even what you just broke down about like the, I don't know if voltage is the right, but that makes a huge comparison easier to understand. When you said that to me, it was really, the numbers were so far apart from each other that I think that would make me feel at ease a little bit.
Yeah, it's really within like safe standards. And so like a lot of this was tested in animals before too. And you have to use like hundreds of times more current to actually like lesion the brain or like burn it or cause something like damage to the brain basically.
But don't youth have like still developing brains? So that would be another hesitation, I would think then.
Yeah, that was definitely a lot of people's concerns. They're like, well, my kid's still growing. Like, are you going to mess up his brain forever kind of thing? And I mean, for those reasons, it is important to be cautious, but it's also why we wouldn't necessarily recommend doing it unless you have like a need for it. Like if you're a child though, and you're 8 years old. We had children as young as 6 years old. If you're 8 years old, 6 years old or something, and you have severe ADHD, and then you're already toying with the idea of, do I give my child methylphenidate, which is like the generic name for like Adderall or like Ritalin basically. And you're like, well, do I give them that? I mean, it's the same question. Is it safe? Is it going to mess up their brain? Like, what is it going to do?
Or for depression, they give kids Prozac all the time.
Exactly. Yeah. And there are children as young as that age that have like severe mental health, neurological conditions. And so when we look at something like brain stimulation as an alternative, it's actually significantly less harmful. There's less side effects related to it. There's all kinds of things that make it seem more feasible, but you still have to go through this whole gambit of research to actually demonstrate that empirically, to show that this is in fact everything that we say it is, and that it is safe. And mostly we adapt that by using what we know from adults. So, okay, there's been thousands of adult trials. None of them had any adverse effects. It didn't seem harmful in any of them. Maybe we could adapt it to kids. And that's why in our trial, we ran this big safety trial where we had 30 kids, and then we also got 30 adults. And we actually compared the two groups to each other directly. So we could see if the adults show up to be basically the same as the kids, and the kids, like there's no differences between them, then, well, we already know it's good to use in adults. We already know it's safe. And then we can do the same thing in kids, and we can show that in the same study. Excuse me, then, it makes sense that we could then start to actually translate more of that research from adults into kids, because we just showed that, there was literally no difference between.
Well, and especially since your end goal is to help these kids or help anyone really. But I mean, obviously it's scary to try to venture into new territory, but if it's for a good cause, then you got to try.
Absolutely,
Definitely.
yeah. And so one of the studies we did was called an acceptability study. So after we did that big study, which was like a randomized controlled double-blind study, like a hardcore scientific study, then we did another one where we interviewed families who participated in that study. So it was like a follow-up study, and we interviewed them, and we asked them all those types of questions, like, why did you participate in our study? Like, what motivated you to? And we found out that a lot of the parents were motivated to participate in this new brain stimulation study, even though it's a study about something that could potentially help their kid was kind of the main thing. But it seems, off the face value, it's this thing about new medical treatment and brain stimulation in my kid. Like, it seems a bit scary. I understand that.
People want lots of years of, proven research and all that. Yeah.
We asked them, what motivated you to participate? And we found out that really a lot of it was because like they felt it could help their kid, and they have tried all these medications and the medications don't work, or they've tried all these medications and they don't like all the side effects that the medications have. Like their child gained all kinds of weight, then they lost all kinds of weight, or their child, it affected their mood and like so many other things. So they're like, we are hopeful that there's like a new alternative. And so that was sort of a really important paper as well to help us facilitate, I guess, like our knowledge transfer for that, and to create a more, I guess, like safe understanding of like what is required from the parents' point of view and from the children's point of view to create a safe and
inviting sort of environment
for them. Exactly. Like, how can we offer this treatment in a way that's considerate of all of your needs?
Yeah.
And because we realize, like, we're the ones doing it, and we realize at face value, if you don't know all the literature, if you haven't read everything about it, and you're just asked this in a waiting room of a psychiatric clinic, and somebody hands you a pamphlet and says, would you like to participate? It's, not everybody wanted to sign up, right?
Yeah. But did you have people return that loved the therapy so much that they wanted to continue on?
Yeah. There were lots of people who were very keen to continue and to do more of it. And so that's where my research goes nowadays, is really, we want to make this more available, because in order to actually, like, there's nowhere, well, I shouldn't say nowhere, but if you're a child particularly, like, there's really nowhere where you can just go now. Like, if you were to call your doctor and say, I want to get direct current stimulation therapy, like, I guarantee you most doctors haven't even heard of it. And most of them wouldn't know where to refer you, even if they had heard of it, because there isn't really any clinics that offer it. Yeah. There's not really hospitals that offer it.
You'd have to be lucky enough to get in on one of these trials.
To get in a research trial, exactly.
Wow.
So we're trying to make it more available and get more people doing it. Right now, it is approved.
To you, man, for that.
Appreciate that. Yeah, I mean, it's been a long haul, and I mean, sort of kind of really helped. This was like a big part of my career, was building these studies, and now we're trying to get it approved for more things. Like Health Canada has approved it for things like treating chronic pain, treating addiction, treating depression, but that's only after like 20 years of hardcore research that had to go through to like get to that level of actually getting approved. So like Health Canada has approved it, FDA has approved it in the United States, Australia and the EU.
But now the next step is building the clinics and
getting people to actually start to
having
offer it.
outlets for that.
Exactly.
Yeah.
And it's not a very like profitable treatment, which is another reason why there wasn't a lot of that research fell on people like myself who were doing like PhDs or, you know, graduate students and, you know, local doctors who are interested. There's no like big pharma companies picking up direct current stimulation because there's not really a lot of money to be made in it, just simply based on the value of the technology. So like you can buy a direct current stimulation device on Amazon now and I wouldn't recommend that. Certainly, like, but you could. If
you can also buy a tattoo gun.
Yeah, exactly. That's a good point, right? Like you can get a lot of things that you probably shouldn't use.
Yeah,
and they're like a few $100s. Like ours is like more like $10,000. It's a scientific grade device, and there's certainly something to be said about consumer grade devices versus medical grade devices.
Yeah.
But even that, like a $10,000 device, technically it's something you can make fairly easily, but there's a lot of like safety things that are built into ours and lots of different procedural stuff that's built into our device that you can't find in other ones. But even now, if you're a doctor, I would recommend, if you are out there listening and you are a doctor, you can get one. And there's a great company called Soterix that makes them. There's even a company in Ottawa called Neuroleve who specifically manufactures these devices for chronic pain. And the doctor, there's a medical doctor who owns that, who used to be a physician. I think he's like retired now mostly, but he was a physician. Primarily his focus was on treating people with chronic pain. And then he started this company in like 2010-ish or so, and called Neuroleve. And, you know, that's an Ottawa-based company, so that's why I bring it up, because it's you know, close to home here. But there is, you know, globally, there's this company called Soterix, and if you have to be a physician to purchase the devices, and you can get them now for like, you know, $500, $1,000 or something for a basic device. And for those reasons, like these pharma companies, there's not much money in it, because kind of like any reasonably good engineer could like make one of these at home in a garage, you know? So
I was going to say, wouldn't the doctor need special training on how to use it as well?
Yeah.
On a patient?
Yeah, exactly. If you are a doctor and you decide that you want to start using this in your clinic, the companies you purchase them from will basically like provide that training along with it. Sort of like a turnkey solution they give you. They send you the devices, they come and train you how to provide this service. And the technology is getting a lot better too, because like, you know, you can, like, I've trained so many people on this too, like in my lab from like a research point of view. So like when we have new graduate students and stuff and they're getting involved, and I train them how to use it myself. But now it's more sophisticated now than it used to be, because you can, you know, you could do it on somebody's brain using measurements of their scalp, basically. So there's different ways of knowing what you're targeting, because you can't just put it anywhere. You do have to put the electrodes in a particular spot.
Not everyone's brain is exactly the same, right?
Everybody's head size is different. The shapes are different. The age, like all these little factors. So there's ways you can actually measure the brain using something called the EEG 1020 system, which is like you take percentages, like 10% from here to here, 10% from here to here, 20% around. And you can basically find all these particular brain regions with relative precision, but you're only getting about a centimeter worth of precision. There's a way that you can get more precise, and that's like if I actually scan your brain using like an MRI or something, then we can get like millimeter precision.
You can map it out.
And we can actually map it, exactly. And that's costs a lot more money to do that, of course. And so usually, again, that's only happens in research trials at this point. But it's something that, again, the level of sophistication is getting higher. We use like 3D coordinate systems with like sensors. And I mean, earlier you mentioned magnetic stimulation. And
I was going to say, because this is a big part of your Stanford thing, right?
Exactly. Okay. Yeah. So there is and let me know if I'm talking too much.
No,
please.
I have a question though.
Please. Might interject. He's a scientist. So
well, I'm not going that route, funny enough.
Okay.
But what I'd like to know, or one of the things that might slow its adoption is these docs are going to need a no-hip billing code.
Yeah, no, that's absolutely a good point. If there is no billing code, they are apprehensive, because it's like, what do they call it, right? How do they bill for it?
Yeah.
And there isn't, I don't believe there is a billing code for it. Not yet, at least. There might be for magnetic stimulation.
What does OHIP stand for? Like, I have a rough idea, but for listeners in Dublin.
Yeah, the Ontario Health Insurance Plan.
There you go.
The Ontario, I think it used to be the Ontario Hospitalization Insurance Plan.
I just thought of my health card when you said it, but I had no idea what the acronym stood for other than Ontario.
No, that's true. This is a global podcast, man.
I'm learning that. Yeah, I've got some people here and there, and I appreciate you guys.
Yeah, so no, that is a good question. Basically, like if your country's health insurance plans, for those of you who have universal health care, if they don't cover that, then doctors will. So at the moment, there's some doctors who could prescribe it as what's called like an off-label treatment, but there isn't like like a specific billing code, and so it's like, how do you actually bill for that?
Kind of a gray zone right now.
Exactly. So it's like we want to get it to a better place, and that's more from like I do know some PhD friends of mine who I've met that are like working on policy related, more from like a government point of view, to try to affect policy to introduce that sort of thing, and I mean, that's a whole other area of.
Can you tell me a bit about how the magnetic stimulation would differ from the electrical?
Yeah, no, that's a wicked question, and this is something I was just teaching a lecture on this last night. I teach still at the university here in Ottawa, but it's all virtual, so I'll be able to maintain that role. I've been teaching since 2016. At Carleton in neuroscience department. I mostly teach clinical neuroscience, and then I have this one really, really cool course, which maybe we could talk about some of that stuff later, which is on emerging technologies and brain-computer interfaces, and I just kind of teach all about that kind of stuff, and we talk about like new neurotech, and so anyway, I just was teaching them about this yesterday, which is like some of the differences. So a lot of what I've talked about up to this point was about direct current stimulation, which falls under the umbrella of electrical brain stimulation. Then there's another type of brain stimulation that has its whole, so that like there's like 20 different types of electrical brain stimulation, which include things like ECT, electroconvulsive therapy, alternating current stimulation, direct current stimulation, and a bunch of other like versions of that. But those are probably the most popular. Then there's this whole other umbrella called magnetic stimulation. And remember, our brain's an electrical chemical system, or rather, it should be more precise. It's an electromagnetic chemical system. Put all those three things together, it's the electricity, the magnetic properties of the brain, and it's really the way that the electrical and magnetic properties interplay that releases chemicals in the brain. And different chemicals have different magnetic charges to them and different electrical charges. So like if you remember when, back to like physics class or chemistry, when you look at different atoms, they have different charges to them. Like how many electrons does this one have, and how many, so if it has like a negative electric charge or a positive electric charge, then you can have a more positive atom, a more negative atom, that sort of thing. And that is ultimately what makes up our brain, these different chemicals and the different charges that exist on them. So we can alter the electrical properties by introducing electricity, but similarly we can alter magnetic aspects of the brain by introducing magnets to them. So to your question, which is like, what are some of the real differences between them? So I'm really excited because the work I'm going to be doing at Stanford is more with magnetic stimulation, which is if you're in the field of neuroscience, it's like the sexier technique to use. Like people are like more into it.
I would assume you wouldn't get those prickly tingles in the same way, or
it's like different sensations. There are actually some people who experience it to be a bit painful depending on where you're stimulating, because basically in this case you're actually stimulating the nerves too. The pain is more so because our brain actually doesn't have any feeling. You can like poke the brain and drill into it, you won't actually feel it, but what you feel is the nerves that are in your scalp and it's your skull.
And this is why they can do open brain surgery where the person's still awake and stuff, which is so gnarly.
That's there's some really cool research on that too. I've seen some wicked videos.
They'll poke a spot and say, what do you smell?
And they'll use things like magnetic stimulation in those as well, actually, to if you're doing brain surgery, like let's say you're dissecting or you're trying to remove a tumor from the brain, you can sort of like draw a perimeter around the tumor using magnetic stimulation, because if you're hitting the tumor, it will not respond because it's not going to fire. It's not going to cause any neurons to fire. So basically, you can like draw a perimeter precisely around the edge of it. So as soon as you're hitting tumor, nothing's firing, something's firing. Okay, don't cut there, because as soon as you see something firing, that's part of the brain that's still working. So then you draw this perimeter around it. And so a lot of the time before you go into a brain surgery like that, you'll like draw this perimeter around that part of the brain. Exactly. Yeah. And then you say, don't cut anything outside of that because that's still good brain. The rest of it's tumor. And then you can...
How do you get the depth?
Speaking of brain depth, though, we got to show this sick photo. Look at that thing. That's... Oh, sorry.
Flip the camera.
Yeah, Matt brought this. We're going to throw this up on the wall, but I just thought this was relevant. This is a brain.
This is, it's like a cross-section of a brain where we look at like different, these are pyramidal neurons and apical dendrites that like reach upward to the top layers of the cortex. So you can kind of see, this is like a higher level of the cortex projecting down to the bottom. What you can kind of see here is like different layers of cortex and stuff. I printed these photos so long ago, I can't remember necessarily even what part of the brain this was, but I had some prints of things like this and things that were up in my office. And when you mentioned to bring something, I was like, that's probably perfect.
Dude, I love it.
And it's suitable for me. I mean, it's at least something that when you see it, you'll be like, oh yeah, that was here because I had that neuroscientist here. And
of course, no, I hope you'll sign the back or something.
Oh yeah, I could definitely do that.
It makes me think of like, it could be like an album cover or something though.
It would probably
like
make a good cover,
or something. Sorry, my dad had asked about the depth.
About the depth, So magnetic stimulation can definitely go deeper than direct current stimulation. That's a good point as well. That is one of the differences. Basically, we can increase the depth of the magnetic stimulation by using different types of magnetic coils. So usually at this point, I'd pull up a slide with 4 types of coils on them, and then I'd show you all the different coils that there are. But basically, the way magnetic stimulation works is, so the simplest type of coil looks like this. It's just a circular coil. Nobody really uses those anymore, but those emerged in like the 70s. But now they often use what's called a figure-8 coil, which would just be 2 of these side by side. So what happens is, when you pass an electric field, sorry, I don't keep bumping the mic. Basically, if you pass an electric field through a circular coil or through a figure-8 coil, by passing an electric field through that very quickly, or an electric charge rather, it creates a magnetic field around it. And that's where the magnetic properties come from. So when you place that over the brain, it will introduce, it'll change the polarity of the neuron. So the inside of a neuron and the outside of a neuron are always differentially charged. So the way that we have what's called synapses or action potentials when our neurons fire, basically, which is what makes, we have thousands, more like millions and billions of neurons firing every second. That's what makes us function. And they fire and then they release chemicals into the synapse. And then the synapse, will recycle all those chemicals and pick them back up and then use them all over again and so on and so forth. But the inside of the cell is always charged differently than the outside of the cell. Now, when you introduce the magnetic current to that, you basically just flip the polarity of it instantly. So it causes an action potential to fire right away. And that ultimately is actually the main differentiation between direct current stimulation and magnetic. But I find the minutia of that is probably a little bit too detailed to bother trying to actually really explain right now, which is just that direct current stimulation can change the potential of having an action potential. Like it can increase the likelihood, but it doesn't actually cause the neurons to fire. It will make it more likely or less likely depending if you use a positive current or negative current. But the magnetic stimulation actually causes it to happen because you introduce such a strong magnetic field that it will flip the polarity.
Probably why people say it's less comfortable or more,
Yeah, and it's all the nerves that surround it and everything on the scalp, and that it's also affecting those as it has to get through the brain. And so to get to the depth, again, to the question of depth, is the way that we started with the circle coil, then there's a figure-8 coil, which is just like 2 circles, and then there is an angular coil where you take a figure-8 but then you angle it. Basically, each of these types of coils can go a little bit deeper. Like just a traditional circle coil can maybe go about like a couple centimeters deep into the brain. When you create the angular coil or the figure-8 coil, then the angular coil, you can get even deeper and even deeper. And really that's just by creating a stronger magnetic field. And then there is the most I guess like the most depth you can get is using something called like an HD coil, which is almost like looks like a magneto or like kind of helmet looking thing or like a cerebrum type thing,
That's
where
so
you
cool.
put that whole thing on your head and then it just like has a very, very precise current that it introduces into the head.
And you find all the mutants all across the world.
And that's exactly how it works. So
so generally, as a consumer product these days, there's very strong rare earth magnets that people use, just for their fridges these days. Not those big flat squares, but these little nickel shiny ones, and they stick like the Jesus, right? So you don't want to let the kids be waving those or holding them up to their temporal lobes and messing the polarity of their brains, or is that not strong enough?
I would wager it's probably not strong enough, but it still might not be a good idea.
Especially if you're getting like the industrial strength one or something.
Yeah, but I'm going to say I'm pretty sure that it wouldn't have the right amount of strength for that, because if it did, then we'd probably just use that sort of thing in the lab too.
When we were kids, it was always don't bring it near like the TV screen.
TV, yeah, exactly. Well, I mean, it's kind of the same premise. Like you're just totally messing up the TV system. I don't know enough about exactly how the electronics work, but exactly, it's like you're pulling out the.
Have you ever seen F is for Family? When
I did. Well, yeah, like
he
Bill
gets the
Burr
brand
showed
new
it.
TV, and it's like one of these behemoth things, but they were super cool at the time, and because that show's set in like the 70s, I believe, and the kid fucks it up with a magnet, and it's a whole thing. But yeah, that's what
I do remember that episode. Yeah, and then didn't they like? Yeah, he had to like go and return it.
Yeah, he brought it
was,
back
like,
and tried to say it was their fault or something. Yeah, no, that's a great show. Have you ever seen that, Dan? It's Bill Burr is the voice, and I think it's largely him showing the audience what his childhood was kind of like, except he's doing the voice of his dad essentially.
Right.
And he's one of these guys who can't keep his cool. He's always about to fucking go postal, but he still loves his family. You can tell somewhere down there he's got a good heart, but swears all the time. And
it's quality. That's a quality. And even the kids, I mean, he's funny in that show, but his kids are pretty funny.
Yeah,
like
Justin
the
Long.
youngest one and the
the youngest one too. Yeah, Justin Long is like the fucking guy who looks like he's in the Ramones, and
the oldest brother, right? Like the kind of stoner.
God, shut up. Fucking hate you guys.
Yeah.
Oh man, you have to watch
quality.
it. Shit, man. Well, this is super interesting stuff. I wanted to talk. There was a couple other papers that, again, I absorbed as much as I could. But where's the other one? Oh, you guys potentially identified a new biomarker for concussion and pain after motor vehicle accidents. I thought that sounded really cool. And it was a study that took several years.
Yeah.
Which is badass in its own right. So can you tell me a little bit more about that?
Yeah. I think
this was a paper you were a part of, right?
Yeah, it was. I was the lead author on this paper. This is one of the ones I published with a group here in Ottawa. This was actually outside of my PhD. Like it was just work that I was doing on the side. I was a research director at a private clinic here in Ottawa. And this was published with the doctor I worked with in Geneva as well. So we collaborated on this together. This paper is actually one of the pieces that got me that scholarship to go out to Geneva to work with this doctor, because I had this collaboration. And the whole point of this scholarship is to do international collaboration with Switzerland. So, excuse me. So, that was a really fun paper. And I guess to your point, I'd say actually, sadly, pretty much all of the stuff I've ever had to do, and most science I'm aware of, ends up taking years. It never is fast.
That's kind of comforting in the long run, though, because it would imply that people are being thorough.
We take our time, and I think things move faster if you have more money. That's kind of the main thing.
Or if there's a pandemic. Because people are like, I don't trust this vaccine. It's like, well, my dad was just sort of explaining that to me the other day. Not that I was that guy, the non-believer, but saying that, these emergency protocols really speed up the process that normally gets bogged down with a lot of bureaucratics and all that.
So much red tape on everything, which is generally for good reason.
But when everyone's family is dying and everyone's kind of affected on a global scale, you could see how that would, hasten things.
Exactly. It's all about risk versus benefit. And, if we do as much, all that red tape's there to mitigate risk, but when you have such a demanding reason, like when it comes to something like the pandemic, it takes a long time. And, like to do a major clinical trials, and the reason, most clinical trials and stuff, like they occur over the course of like 5-10 years, because you have to go from phase 1, 2, 3, 4, like you got to go through all these different phases where, phase 1, you're just trying to show that it's safe. Phase 2, you show that it's better than a placebo. Phase 3, you show that it's better than the alternatives. And then phase 4, you go to market, basically. And each of those phases takes 2 or 3 years in themselves. and you have to constantly increase the number of people that you have. So by the time you're like a pharmaceutical company, you're done a phase, you're in phase 4, you probably already had like more than 10,000 people try this, and no small clinic or no small university has money to run 10,000 people in a study. It's just not feasible. Like I just told you about a study, we had 60 people and that was like a big deal, right?
Yeah.
And that's just goes to kind of show like the caliber of this sort of thing. And to get it approved, you really kind of need to have these large numbers. And there's a lot of like statistics behind that can kind of tell you how many people. But I think when it came to things like pandemic and the vaccines, we got those numbers pretty quickly as well. And when it came to the risk, there was that too.
Yeah, they overlapped some stages. So like they started stage 3 when stage 2 is still ongoing.
Right.
They let it run for a while, but it was looking promising. So
Yeah.
they start phase 3 assuming that phase 2 is going to work out.
Right. Yes, and that makes sense. And I think, from a scientist point of view, it makes sense to me how that could go down. And
especially when the whole world is yelling at you like, hey, science guys, hurry up. We
Yeah.
need a vaccine. But then you're also mad at them and you don't trust their vaccine. It's like, I don't know. You can't have both.
yeah, no, you can't go have it both ways. That's it, And so we did this trial. This was using a technique called electroencephalography. So I'll break down that word too. We're like electroencephalography. It's like kind of like 3 words in one. Electro meaning the electrical properties, encephal being the Latin root for the brain, encephal like the encephalogram kind of thing, and the
Encephalitis is like when your brain swells.
yeah,
right?
like of the brain. Yeah, exactly.
Yeah.
Like anything encephal is kind of like the root meaning of brain, and then. So when we call it electroencephalography or electroencephalogram, gram meaning also being Latin root for like image or picture. So basically what that breaks down to is the electrical picture of your brain. And so it's more like a graph where you end up with, what we're reading out is the electrical firing that is going on in your brain using different electrodes. And this is sort of like, again, it pairs well as an electrical technique when we're talking about electrical brain stimulation. And compared to it's a type of neuroimaging technique. The one most people are more familiar with, like what you see in movies or more common in hospitals, are things like CT scans, which is computerized tomography, or like MRIs, like a magnetic resonance imaging, which is again like that's the magnetic property. So it's like you've got a lot of this in neuroscience where you've got a lot of electrical based techniques and a lot of magnetic based techniques, because they're leveraging different physics in our brain, and they're leveraging different physics of the of the tools basically. So when you're using magnetic resonance imaging, you're able to use very high powered magnets to take pictures of the brain. When you're using electroencephalography, you're able to use these electrodes to record electrical activity from the brain. And that's what we used in this biomarker study, which was in patients with concussion and patients who had concussion and chronic pain, actually. And so
from motor vehicle accidents specifically.
Yeah, from motor vehicle accidents, exactly. So that was one of the strengths of our study, so to speak, is a lot of concussion-based studies have, they might have a mix of athletes, people who've slipped and fall and had a concussion, people who were assaulted and had a concussion, people who've been in a car accident and had a concussion. Soldiers, exactly, blast-related traumas, but they all like that. They all have a bit of a different etiology or like a cause. So the cause of that disease can slightly impact the way that the data should be interpreted. But because all of our patients, so we have 57 patients and 54 in a control group, so people who didn't have brain injuries. So we had a total of 111 people, but all of our patients were brain injuries due to car accidents. So we know that the etiology is the same, which sort of eliminates that variable. So when we're doing science, we want to control for as many variables as possible. So if we had 5 different causes of brain injury, well, then that's maybe 5 different ways you should interpret the data. But we have only one cause, so we know that it's due to this, for instance. So we control for those things.
I mean, there's some variety in how car crashes can go down, I'm sure, and the
100%.
types of injuries you're being inflicted with.
Yeah. No, that's a great point too.
Compared to having like all this broad, group of very different things,
Yeah, no, that's absolutely a good point though. And I mean, you can have an injury where your head actually like hits the windshield, or you can have an injury that's just whiplash, where maybe your head didn't even impact anything, but it got whipped so hard that what actually happened is your brain hit your skull. And when your brain hits your own skull,
that's a hard sentence to hear. I don't know why.
It shakes inside your head like a yolk inside of an egg.
Yeah,
right?
I'm already picturing.
Yeah, so that can happen. But when you've got For instance, so that's different than like a blast-induced trauma. Like if you're a soldier and you have like a concussion, like a concussive blast that you feel, like that's a shock wave that gives you a brain injury, versus like slipping and falling, you can hit your head. But what's still different about that is that the actual experience of a car accident as a whole is a different experience than, say, two football players hitting their heads together. And you might say, okay, why is that different? So if you're in a car accident, you hit your head off a windshield, why is that different than two football players butting heads? The difference is that the football players expect to do that, so that their mindset is actually quite different in going into it. When you experience a car accident, you experience a few things all at the same time. You experience fear because you're not expecting to be in a car accident.
So adrenaline.
So you have a sudden onset of adrenaline, of fear response. Usually there's like an onset of like panic for a lot of people. That can often induce and lead to things like developing PTSD later on. You also have an onset of pain that was unexpected, and it's some of those factors really weigh into being able to like predict outcomes of, okay, if you're in a car accident, and so let's just break it down like this. If you're in a car accident and you're very calm afterwards, and you're like, okay, I was in a car accident, and my head hurts a little bit, and that sucks. This wasn't great experience. Even if it was like relatively severe, but you came out fairly safe, and you're a person who's like very resilient, and maybe it didn't affect you that much, your response at the time of the car accident is actually very predictive of whether or not 4 months from now you're going to develop something.
If you've got trauma, it's going to be lasting. Yeah.
And whereas if you're the type of person, you're in a car accident, you get out, you're panicking, everything's crazy, you're in shock, you're crying.
That would be me.
The likelihood of you developing something months down the line is much higher. Like you can kind of predict based on your initial response how it's not always hard and fast, that rule, but that's, there's research that's demonstrated that. And so anyway, all this is to just say that there is, by having everybody from a car accident, it's the experience in itself of the car accident that shapes a lot of the way these things develop. And so we came up with these biomarkers using electroencephalography. So we look at all these different electrical properties in the brain, and then we look at different regions of the brain, and we see what was different between the patient group and the control group. So the control group is just a group of like, so to speak, healthy, or we use the term neurotypical. So like they have no mental health conditions, no neurological conditions. They're just healthy adults who we've scanned their brain, and then we match them for age and sex. So like we have the same number of males and females, basically. They're relatively the same average age, because like things like being male or female or being older or younger, you have different types of brain activity. So you try to match up that, again, just controlling for variables. And then we see what's different in the brain. And then we use traditional statistics to do that, to like derive these differences. And then I built a series of machine learning models that were able to predict with currently what is now the highest published accuracy for—
It was like 87 or something.
87.6%, I think.
Damn.
There was some studies that were pretty close to that were published before, like 82, 83%. But
you're not 87.6, bitch.
Yeah. So we hit that 87.6, man. And so that was a nice
if someone
finding.
comes for 90, are you going to be like motivated to go back and
But no, at the same time,
title?
I'd be excited still. And the thing is, even 87 though, people will still say it's like not good enough. Generally, to get real clinical models, like if you want that to be adopted to be like ubiquitous in clinics, like you have to get 95% or higher accuracy. And there's also still steps we have to take. So we got 87% predictive power at the group level, but really we want to be able to apply that to every single patient. So if you're one person and you come in, which requires more power, so there is still steps we have to take. Like we need to independently validate these results now. So they were validated using the machine learning models in I don't know if it's worth getting into it basically, but you create like a holdout set. So you create a model and then you test that model on a sample that had nothing to do with the other models, so that you can make sure that you're not like biasing one model. But really now the next step is repeat that same study in a brand new sample and see if you can replicate your results. And if you can replicate that again, then it's pretty valid. It's validated in an independent sample. So we're working on doing stuff like that right now.
Man, that's so cool.
Yeah.
Maybe you can speak to this, because I've been told, I can't remember who told me this, but it sounded plausible, that when people get into a car crash, oftentimes a drunk driver will survive unscathed because they don't tense up because they're so carefree and drunk. Is this true? Would that have any?
Yeah, I've heard this before too. I guess my response would probably be along the same line of like anecdote that you've heard, because I don't know if I've read anything specific in the literature about that, but I've heard that like anecdotally as well.
Yeah.
That, like if you're a drunk driver, that you, because of the fact that you are more calm, more limber, more relaxed in general, like your response at the time of the car accident, assuming that you didn't get like impaled by something that actually directly either kills you or causes significant
What if you
damage.
just get flung from the vehicle?
Yeah, that you're perhaps more likely to come out better than the victim because of the fact that you were just your state of mind at the time and in your body, the level of relaxation among your autonomic and peripheral nervous system are better. And actually, that's a good point about drinking and driving. First of all, don't do it.
Yes.
But the people who do, usually it's because they convince themselves that they don't also realize that your central nervous system and your peripheral nervous system are disconnected. And so your central nervous system, which involves your brain and your spinal cord, might tell you that I feel fine. I could drive. No, I'm pretty good. I'm cognizant. But what you don't realize is that while you're saying that, you're kind of stumbling and moving around, and your motor
slurring
skills,
your speech a little,
because your motor skills are peripheral nervous system, and that is also impaired independent of your central nervous system. So even if you think that you're fine because your brain is telling you you're good, you don't realize that your motor skills, your reaction times, all that's impaired at the same time. So it's like,
which would imply that your brain's a little impaired as well, because you're not noticing your own slurring and stumbling.
Yeah, exactly. I mean, your brain is definitely, it is impaired, but it's like you get that drunk confidence too, and you're like, I'm good to go. And,
well, at the beginning, it always kind of feels like that, but there is a point for sure where you get drunk enough that your brain starts telling you like, whoa, I can't make out where I'm going, or whose face is that? Don't get that drunk, and definitely don't drive if you are that drunk. Oh, there was another recent paper of yours that I read about, again, a team you worked with, but an imagination and how it interacts rather with perception, which just sounded cool in the title. A lot of these were really not easy reading, though.
That one is probably the most dense technical paper I've ever published, and it's not for light reading.
Is it for podcasting, or?
I could give you the gist of it, but I won't get too into it. Basically, it was just like we were looking at, this is some work that I actually started doing like early in my research career in like 2013 maybe. I started working off in a field that was called cognitive neuroscience, which is more like neuroscience based on like mechanisms in the brain and things like that, as opposed to where, by like 2014, 15 into like present, like now I've been strictly focused on even though this paper did just come out, I guess I dabble, but it's like I mostly focus on clinical neuroscience, like you had noted earlier, which is the clinical applications of doing neuroscience, sort of the intersect between medicine and neuroscience. Yeah, and I always say as like a joke, kind of like, I mean, it really wouldn't hit in a club, but it's like a joke I make to like my neuro friends that I'm like, it was my way of like getting as close as I could be to being a neurologist without having to go to medical school, because I didn't go to medical school. I'm just a PhD, but I did clinical neuroscience. And so it's like, I'm close to being a neurologist. I'm just like, I'm not quite there. And
hey man, you're still young.
But I mean,
if you ever want to go that route,
I've thought about it, but I just don't think I have it in me anymore. I don't know how, even looking back, I don't even know how I did some of the stuff that I did. I'm like, I'm gassed, man. Like, I don't know how.
How old are you?
I'm 29.
Oh, okay. I wasn't sure. Like, I couldn't really place you.
Yeah, I don't know. I still have, I'm reinvigorated for my new position, but I was just kind of, I'm like, I don't know how I did some of the, just like the number of hours that you had to put in, and just some of the way that having like 5 classes back to back, and then you gotta like, there's so much. It's kind of different when you don't have to go to class anymore.
It's called youth.
It's an energy I miss. But so the gist of that paper though is like, we wanted to know. It's my PhD supervisor. His career is largely focused on this aspect of neuroscience, about imagination and perception, and imagery and mental imagery, hallucination type stuff. And then there's perception, which is like what you're actually seeing, so that's like more like the reality of things. And so we are really just asking this question of like, how does imagination affect perception and vice versa? And the way we investigated that was by saying, what happens? Like the initial thought, there's a lot of research that shows like imagination interferes with perception if you're trying to do them simultaneously. So basically we would present you with a task, like a visual acuity task, which is a type of task where we show you some stimulus and you have to like tell us, give us some information about that stimulus basically, and, detect it, like where was that stimulus and different things. And we only flash it to you for like, half a second or less kind of thing. Oh, wow. So it's like, we're really just showing you stuff. So it's like a perceptual task. So we give you this task and we flash a stimulus. And I mean, the breakdown of one of these was really simple, is like, there's like a box and then there's a line, like a really thin line. And the line could be either just slightly to the left of center or just slightly to the right of the center. And we flash it for half a second and we say, was it to the left or to the right?
Okay.
And you're like, I don't know. I mean, you're trying to think, was it left or right? And, if you're quick enough, technically half a second is long enough to detect it perceptually.
Yeah.
And then you would have to answer, was it left or was it right? Was it left or was it right? And you do that hundreds of times, basically. And then we would calculate your accuracy, like how well did you do on that? And then we would do the same task again, but we would ask you, now while you're doing that task, imagine different things at the same, while you're doing the task. And we'd see, did that decrease your accuracy in performance of this task, or did it increase the accuracy? Our prediction was that it would actually decrease.
That's what I would have said, yeah.
But it turned out for a lot of people, it actually increased their performance by imagining at the same time.
Weird.
And it was weird, not expected. And so then we had to...
it's hard enough just to do this.
I know, right?
Yeah,
it's like,
I screwed it up right there.
There you go.
And I know that's visual, but something that I always wondered about was when I was in school, there were people who studied listening to music at the same time.
Yeah.
And there are other, like I could never do that. I needed dead silence pretty much when I studied. And so was this auditory stimulation working the same ways as visual stuff, using your imagination, like two things combined together, I guess, for a better outcome?
Yeah, no, good question. Like, and I think it's, so one of the, it was kind of really not a very interesting explanation for all this, is that it came down really to individual differences. It was hard to necessarily find a group level explanation for this, that some people will be one way and some the other. Like I personally, I love listening to music while I study. It definitely helps me a lot. One of my professors, I remember she used to always tell us too, like she needs silence when she's doing stuff. She cannot study with music. That's like a whole other thing.
I could do some things with music, but I would not study with music. I don't think. No.
See, I almost need music when I'm studying, like only very seldom when I'm trying to like laser lock in, when I need to like, will I shut off my music? Otherwise, I'm almost always running music in the background.
He made me think of something when he brought up music, though, that imagination lends itself very well to listening to music, because especially if there's lyrics, you can generally paint a picture of the story or whatever's happening in the song, lyrically speaking. But that would be still very different from listening to a song and trying to imagine something that has nothing to do with the song. Yeah. Like that, completely different parameters there.
Like the don't think of an elephant.
Yeah.
What are you thinking of now? An elephant. Right?
Well, that's a life of anyone with OCD. Don't think about this thing that stresses the shit out of you. Oh, yeah, I do that every fucking day. But hey, maybe I need some of that transcranial action.
Hey, man, it's one of the big studies at Stanford is on OCD. It's
I know they're doing that with shrooms as well in Arizona or somewhere.
Oh,
for OCD specifically. It was the first time I had seen one.
Oh, neat.
It might have been last year.
I know, like the Ottawa Royal is doing a lot with ketamine right now too.
I've heard that for depression.
Mostly, for. I don't think for OCD, but for depression they're doing it, and it's supposed to be quite effective.
I've heard a couple comics talk about that. Neil Brennan's done that, I think, and someone else. I'm forgetting.
Are you sure they're not just signing up for the money? They're like, hey, I heard they're offering $50 to take ketamine.
No,
like I do that.
He's a real. He seems like the real deal. That dude. Yeah.
Wait, Neil Brennan or David Brennan?
No, Neil Brennan. David Brennan's awesome. He's been on this show, but
I thought so. Yeah.
Neil Brennan's the dude who was co-creator of Chappelle's Show.
Oh shit!
Really skinny, bespectacled fellow.
Oh yeah, I think I could picture him. Yeah, I was thinking
he has a great special on Netflix called 3 Mics, where he keeps switching from the mics. One of them he only does puns on. One of them he only tells stories on, and it makes for a really cool special. Concept. I can't remember what the third mic is.
That's a great concept.
Apologies to Neil Brennan, but Go check it out. I will say, plug his shit. Because we've already been talking forever and it's so fun.
Yeah,
let's pivot to your book, man.
Totally taxed people on this neuro stuff. I mean, it can be heavy, man, to listen to.
Hey, man, not every episode's for every person, but I'm having a blast. I didn't know anything about this. I'm following along better than I thought I would. But I do want to talk about your book, which you were nice enough to bring a copy.
Yeah.
Because both my dad and I, we were talking about it's a very intriguing title that sucks you in. An explanation for life, the universe, the brain, the mind, and consciousness.
Yes.
Apparently, the answers lie within.
Yes.
And I did like that the earth was an egg, sort of the birth of,
No, I appreciate that you're taking in the art, and it's something I actually designed nearly every aspect of this book: the cover, the title, the back, the everything interior. Because for me, it was like a hobby project. Like I can put it, this book isn't necessarily meant to forward my scientific career in any way. It was a lot of the things that I do on the side for projects like this, doing comedy. It's about my hobbies. It's about my interests. It's about really feeding the child in me that still exists, and the fact that I started doing a lot of this stuff when I was young. And yeah, I mean, I appreciate that you've taken in some of the art in that way, actually. Because
I got the feeling that this book is short snippets with a philosophical edge, but grounded in research as well.
That's very good explanation for it. Yeah, it's exactly that. It's written in short, like stanzas. I wouldn't call it quite poetry because it's not written necessarily poetically, but some of my good friends, I guess, have described it to me after reading it that it's almost like you could replace the word an explanation I think is fair, but you could also say like contemplations of life, the universe, the brain, the mind, and consciousness, like where contemplations is sort of like a philosophical approach to just saying like my contemplations of these things, my interpretation of these things based on what I've learned and read in science. And part of my motivation for writing it was the fact that I do have a lot of friends who aren't necessarily from a scientific background. And one of the things I would hear very often about a lot of these things is, we don't know anything. I remember growing up, even people would be like, we don't know why we sleep. We don't know what consciousness is. We don't know about death. And I'm like, if you read more, you would. Like there's lots of books about it. There's lots of papers about it. Like I've read many of them, and I've found a lot of those answers because a lot of my life has been pursuing a lot of these answers because I'm very into this type of philosophy and this type of science and learning. Like I've always been trying to just, I guess, find myself, find my place in the universe. And I think I've found a lot of those answers myself. And I felt like I needed to share my interpretation of that with people because, and from my point of view, there are answers for most of those questions that so many people say there's no answers for. And I'm like, there really is.
This being the meaning of life, big things like that. So I was taken aback a bit when I was like, okay, so he's saying that if you read this book, you're going to know the meaning of life in a nutshell.
In a nutshell.
But part of that is as we were saying, like the title before the podcast, you were saying part of that is a sales to get your attention, pull you in. Because honestly, if someone makes a claim like that, you almost want to read it to be like, let's just see about that. And then you end up reading the book anyway. So
and then I've already got your money. And then you've got the book. But no, honestly, it's like, it is, part of it was, I wanted something catchy. And hey, in my book, I call it whatever I want.
Fair fucking enough.
So when you put that out there, it's something that it is catchy. It does sell like that. Like when you see it on a shelf like that, for instance, and it's in over 100 countries, like this book's available around the world now. And so I was also trying to think, what's something that somebody could read anywhere in the world that would mean something to them. Similar, what's one of the reasons why I used a globe as well, because I'm like, what's something that somebody anywhere in the world can see and relate to? Well, it's the fucking world, man. We're all in it. So it's like, that means something to everybody. And why on the back I use like the cosmos and stars and, looking at galaxies.
I suppose the only people who might not recognize the globe would be like those few civilizations that are still undiscovered,
right? Or like a flat earther or something.
Yeah, but even they would know. They'd be like, "Oh, that's that sphere the man keeps trying to sell us." Like they would have still seen it and know contextually what people are saying it is.
Yeah, hopefully,
which it is. Fucking flat earthers. Good Lord, let's not get into that. Well, man, thank you for bringing it, and thank you for personalizing it. I do want to. Is there anything else you would want to say about the book, just for people that might be interested?
I mean, I guess if I'm doing like a pitch, I guess I could just say that it is available pretty much like anywhere you could find it. Like it is in a lot of bookstores, like physically, but it is also on Amazon. Like you can order it from Chapters, Walmart. If you're in Australia, I think you guys use something called like and now I'm not gonna be able to remember what your bookstore is, but it's on like whatever your online book thing is.
Dolls they do.
Yeah, you find it in a kangaroo's pouch somewhere.
Well, it was. I don't know.
Barnes and Nobles if you're in the U.S. Like it's basically wherever you can find it. You can just search the title. I'm pretty sure it retails. I mean, in Canada, it retails for like $17.99. And
I just lost my only Australian fan.
He's and yeah, where it's the price is different depending on what country you're in, but it's basically just like prorated to wherever you are. And I mean, yeah, I would appreciate you read it. And
$17.99 or something I saw.
Yeah, it's $17.99 in Canada. And I guess I don't know if you showed the inside to the camera or not, but it's like you get an idea of like, so the way that it's written was sort of in this style where it's like in just clips of things. So like the whole thing is written in this fashion, which is why I sometimes refer to it more like written in like a poetry style.
Very digestible.
Yeah, it's a lot of people read it in one sitting. It takes you a couple hours maybe, or maybe I've that's what's great about having so many people who have read it now and given me feedback on it. That I've had friends who told me like, man, I couldn't put it down. Like I literally I sat down, I read the entire thing. It took me like, an hour and a half, 2 hours. I just sat down, I read the whole thing and it was great. And I've had other friends who told me like, man, I gotta chill on it like every 5 pages because they're like, I need to like digest. I need to think about this.
Yeah.
Like, that's how I tend to read a lot too, is like I'll I'll read a lot and then I'll stop and then I need to really think about that reading. And, a lot of what's in this book was inspired by many, many of the books that I've read that answered a lot of these questions. And it led me to deciding, I want to write my own version of this basically and write
I'm definitely
my own.
still listening.
Yeah, no, I have at it, bro. And,
but yeah,
so
it takes time to process deep shit like that if you're really, really paying attention. You know?
So there is like different chapters like I talk about, and it's sort of organized in what I hope and from what I've heard from people in a very logical, flowing way where it starts off, starting at the beginning of the universe, because that's something else. Like I try to get into things like the beginning of the universe, the end of the universe, what we know about dark matter, the expansion of the universe, basically like how did life emerge? And that's what I mean by when I'm saying like an explanation for life. Like I'm not talking about, a very God-oriented point of view. I'm saying, how did we start from a single point of infinite density, and how did that point of infinite density expand into something called space-time, and how did that develop galaxies, which led to development of planets, and how did those planets end up being able to have life on them? Like those are really complicated questions, but I think there's quite simple answers to them once you break it down. Like how did we end up with a galaxy? And it's okay, well, from a physics point of view, when you have a point of infinite density, the only option for a point of infinite density is to expand because it's infinitely dense. So the only thing that can happen after that is to become larger. And as soon as that point expands, you create space and time because now you have 2 points and you have a distance between those points. And if you measure the distance between those points, what are you using as a unit of measurement? So the distance between that takes time to travel it. So now you have space and you have time. As that gets larger and larger and as that expands exponentially, you end up having more space between them. Eventually, the universe cooled enough that atoms were able to pool together and start clumping together basically. And then as, billions of years went on, that pooled into galaxies, which pooled into planets. And, like the Earth, like I talk about in here, the Earth was originally so hot, it melted itself. That's why underneath the crust is lava and everything. It still exists there today. And all of the heavy metals sunk to the core of the Earth, which is why the Earth's core is largely made of iron, is very magnetic because it was so hot that everything heavy sunk and then everything lighter rose. And then it was so hot in that way that it released gases. And eventually those gases pooled on the surface of the Earth and those gases turned into water. Those were water vapors. But gravity held the water vapors so close to the Earth's surface that it eventually pooled into oceans. And oceans eventually led to life forms because when you had enough oceans that existed and it created plant life, and then the plant life held enough oxygen close to the surface because of gravity. So gravity again held the oxygen close, which created our atmosphere. Once you had an atmosphere, that led to more better conditions to have cellular life. So then that led to real life things, and then that life developed and evolved through evolution, like Darwinian evolution. And then that's like the first 3 chapters, And
wow. I mean, that was a pretty good breakdown. But isn't it, philosophically, isn't it just a little bit insane that all those things had to happen perfectly to result in us podcasting right now.
That's the anthropic.
That's the real
principle.
trip. Yeah.
So that's like a whole other read. If you look up something called the anthropic principle, which is basically what you just said, it's the idea that like the world exists the way that it does because if it didn't, there wouldn't be anybody here to observe it.
Oh, like the Watcher.
Yeah, that sort of thing. It's like if you, I don't know. Yeah, it's interesting this concept of observer and things, and then I talk about what that means to be conscious, and then the meaning of life, which is really just about being conscious and manifesting consciousness and taking things from your consciousness and turning it into reality. Because your consciousness, the things that you think about, the things that come from your brain, from your imagination, that turn into something real, that's the meaning of life right there. It doesn't have to be making something, but the meaning of life is just taking something from your consciousness that didn't exist before and now it exists. What else is like?
I would argue sharing that with other people is, an additional meaning of life.
100%.
Because isn't that the argument that if you have like the Mona Lisa on Mars, is it still art? I've heard that. But if no one is there to witness it or observe it or be in its presence, does it cease to be artwork? Well, what would you say? It's just a brain scratcher. I like that one.
Yeah, no, that's an interesting question. I think I would say that to the person who created it, it was still meaningful to them.
True, it would have had to still been
their
created.
meaning of life. But to the greater universal consciousness, it is certainly meaningful to share those things with other people. But I think that there's still a lot of people who maybe create things and find deep meaning in their life that don't care about sharing that with other people.
That's true.
And that's still a very meaningful way of living, I think. But for some people, it is really nice to share that and to like have it displayed. Like for any, basement podcast or basement artists out there, I think it still gives you deep meaning for being alive, for whatever it is that you're creating or whatever it is that you're doing. Just the fact that you're alive and doing it is the meaning. So it's one of those like kind of like a Neil deGrasse Tyson, like Dick kind of scientist answers, where like the answer is like it's meaningful because it's meaningful.
Smart ass science.
Like, well, that's not quite what I was looking for, but it comes to a level of like metacognition to, I guess, be able to appreciate some of those sentiments. And I think it's something, I don't know if I have it on my website yet, but I've been meaning to put it up actually, because what I wanted to do with this book too is like put like a link or like on my website that if you go there, that I have a list of like recommendations of here's all of the other books that I read. Because I think if you just read this book, you might not necessarily, come out with the insight or all of the thoughts that I'm having, because it's, for me, it's writing this book plus this whole list of other books that I read that contributed to this overall picture that I now have of the universe and stuff, and stuff that I've spent a lot of time thinking about.
Let me just ask a little thing here. There are these things, these concepts that are introduced to us that are difficult to grapple with. One of them used to be infinity, although that one didn't bother me too much because it just keeps going. I can go with that. Mm-hmm. But when it comes to the creation of the universe and the Big Bang, the initial spark, first of all, it's mind-bending that there's this infinitesimally small point of matter or mass that explodes and has populated the entire universe. I mean, but where did that little spark, that little piece of ultra dense material, where did that come from?
Wonderful thought to have, and from what I have read, and
I don't expect you to know the answer, by the way.
I have a good answer for it. No, I do. I think that's a fantastic question. It's a question I've asked myself many times, and I'd say in the last number of years, I did find an answer for that. And the answer that is currently most represented by the scientific community today is that infinite point of density came from the universe before us. So time is eternal.
It collapsed?
Yeah, so time is eternal. There's three ways that
sorry, but that just takes the question one step removed. If you get into the cyclical aspect,
Yes, in a way. But so then you might say, okay, well then where did that one come?
It had to start somewhere.
But that's where the scientists would disagree. They would say it just always has been and it always will be, and it never has to. It doesn't have to have a beginning.
And that's harder for me to wrap my head around than infinity. Okay. Infinity makes sense to me.
Yeah.
That doesn't make sense because in my world, everything comes from something. Yeah. Right? I don't know.
To me, when you bring up infinity, one thing that always bent my brain was eternity, more specifically, and in that. it trips me out to think that, okay, if atheists are right and when I'm dead, I'm just dead. Oh shit, I'm never going to do anything ever again, ever. If you really let that sink in, it'll fucking bum you out for the afternoon. But the alternative, something like heaven, I equally go like, okay, so even if I'm doing the funnest shit forever, like, you know, just eternity is such a strange concept to me.
Yeah, that thought and your thought, Brian, and like death. I mean, I was thinking about this when I was like a child, and it absolutely like tore me up. And I was like, I couldn't wrap my head around it. And I still wouldn't say, I guess, that even like I wouldn't say necessarily that even I can fully wrap my head around it, but I would subscribe to the line of scientific thinking that there doesn't need to be a beginning, that it just always has been, and in theory it always will be, and that there is like a cyclical aspect of it where our universe is 14.5 billion years old, but I think it's like 13.8 billion years old. It's about 14, almost 14 billion years old. But before that, there was just another universe that existed. And in fact, according to a lot of Einstein's theory, so one of the other books that should be on this list that I'm talking about is a book by Einstein. It's a compilation of his essays. This one is it's a book by Stephen Hawking that I'm thinking of actually, that's called Black Holes and Baby Universes. And basically he talks about how like there is all these like other little pockets of universes. And this gets into like a metaphysical point of view when we get into like dimensions and we talk about, you know,
like
string theory. You could think about it that way as an alternate reality.
I've been watching What If. That's why I mentioned The Watcher. I don't know if you're a nerd enough for that one. But
I have watched a bit of that show. I think like What If, or is that...
It's a cartoon Marvel's doing right now that focuses on all the MCU, but it's animated instead. Okay. And it's just like, what if Black Panther became Star-Lord, or like,
oh, that's sick.
They're just, you know, one-shot things, and then that's it, and you move on to the next one.
Like per episode.
But there's a guy called the Watcher, and this is all from the comics. His name is Uatu, and he's from this race of beings that they observe and record everything, but they're not allowed to interfere, even though they always end up fucking interfering.
Or like
you guys suck at your job.
Like the timekeepers in Loki and stuff like that.
Yeah, it's very similar. Yeah.
Okay, no, that's not the What If I was thinking.
Well, actually, no, the timekeepers interfere all the time.
Yeah, there was another What If series. I know the one you mean, because I ran across a couple times, and they would take the same things they do. What if this? But there was much more serious questions.
Oh, more like a historical, like History Channel type. show,
yeah, that's
real people and stuff.
Or like it was like maybe it was on one of the sci-fi, or maybe it wasn't sci-fi, but it was. But yeah, I think I've seen something like that. I don't know if I ever watched it on television, but I think I've seen like YouTube videos of it. Like what?
Yeah, I didn't mean to derail.
No, that's fine, man. I think it's nice. I love the different perspectives, and it actually sounds like a dope show.
Yeah, it's pretty cool. I mean, if you're already following along with those characters, and
yeah, but I guess just to wrap up before we go to something else, it seems, I guess, that the notion of there is the beginning. If you can kind of get past the idea that there needs to be a beginning, that there just is and always kind of has been a universe, but likely multiple universes, the idea of a multiverse, and that even in our universe, which is 14 billion years old or so, that there's multiple universes inside it. So like our galaxy, we're in the Milky Way galaxy. At the center of our galaxy is a supermassive black hole. And at the center of almost every galaxy is a supermassive black hole. And that inside those black holes, so when you get into like early universe physics, so this is something I kind of became obsessed with when I was like writing the book. And I must have purchased more than 100 books while I was writing this book because I really wanted to like nail down the research. And I went through, took me a year to write it, and then more than a year, I guess, to write it. But then also I went through like 3 different like print drafts before I actually like landed on this copy officially. And I was like, okay, I kept doing revisions and then rereading, and I was like, okay, I need to fix this, because I was like, how can I talk about the expansion of the universe if I haven't already addressed this factor? Like I needed it to be very logical, so if you read one point to the next, each page sort of takes you to the next thing. And then I'm like, okay, I was like, I'm on chapter 4 and I'm bringing up this, but like I didn't talk about this thing yet in chapter 2, so it's like I needed to rewrite chapter 2 now, because I'm like, I got to include that. And then it made it very difficult as well, because I stuck to this like 7 lines per page, 10 pages per chapter sort of thing, where I wanted to stay within that frame, because that was just how, from an artistic point of view, how I decided to do it. So I couldn't just write forever, which is, you know, I could have wrote this as like a 400-page book maybe, but I really wanted to do it in this way because I wanted to make it digestible
and approachable.
And something for... And that's also why, I mean, like there's I thought about calling it like a brief explanation for light, but there's already like a brief history of time. There is already what is the Neil deGrasse Tyson one? He's like like astrophysics for people in a hurry, and like those. Like I've read all those, and those were large, influences for this book as well. Among with like Black Holes, Baby Universes, all the Yuval Noah Harari books. He's the guy who wrote *Sapiens* and *Homo Deus* and whatever one came next. A few of those, like fantastic.
These are ringing bells for you, Dad.
Yeah, I'm familiar with them. I haven't read them, but I've heard a lot about them.
They're amazing books. Like I think that. A lot of the anthropological stuff that I got came from like the Yuval Noah Harari series. Then I had tons of Atlas that I read, and then lots of like galaxy books, and then a lot of the physics stuff came from a lot of Einstein, Stephen Hawking, Neil deGrasse Tyson. Like I said, like I must have bought more than 100 books like throughout my time reading this, and then I had like 30 books checked out from my library of like just things I was looking up, and then I'd read things online at like CERN. And when I was in Switzerland, I went to CERN multiple times. That's like the Switzerland
the super collider and all that.
Yeah, exactly. And like learned about the beginning of the universe literally at CERN. And so I guess I tried to apply some of that stuff and put it in here, and I think follow that line of thinking, and you'll eventually find those answers.
Cool, man. I actually wanted to ask you what you think of the Mandela effect.
The Mandela effect,
Berenstein Bears and all that.
Yeah,
you know what I'm talking about?
Yeah, we did Jackie had like a segment of that on my podcast.
I was just going to talk to you about that next.
She did a whole segment of that where that was on her Jackie's Fucked Up Show and Tell, and we talked about her. About the Mandela effect. I don't know, man. It trips me out. Like, there's a lot of, like, I don't have a good explanation for that. I guess you can ask me about the beginning of the universe. I'll give you an explanation. But the Mandela effect, I
just think it's interesting. Yeah, I don't think anyone has a good answer. A lot of people think it's bogus, but the Berenstein Bears one really freaks me out just because I feel like I have quote unquote evidence, because I know myself to a degree, that I would have looked for any chance to make a joke about Berenstain. And instead I remember always trying to remember if it was E before I in Steen. And yet I pick up the book now from my childhood that I still have, and it says Stain, and it just tweaks your brain and it feels wrong. And I guess that's the argument people make with the Mandela effect. But the Mandela one is even crazier. The people who believe that he died in prison, and they remember his funeral and all that being on TV, and it's apparently a large amount of people. So it's pretty weird.
It's really weird, yeah. And there's so many good examples of Mandela effects and things like that. And then I had one happen to me even just recently, which isn't really one anybody could relate to, but it was like I had to submit this like a grant for some money for research, and excuse me, I beer's a bad choice for podcasting. I keep I'm like Bert Kreischer in this thing when he keeps having to clear his
or
throat.
Rick from Rick and Morty.
Yeah. Like I'm like beer, man. It just fucking makes me. And also my sister made me chili before this, so maybe that's
that might be it. Yeah, chili.
That's what we were eating, and I haven't had chili in years. It's fucking good though. But I mean, like I feel like that's just makes for a bad before speaking for, but. She at least it's coming out this end, I guess.
Yeah, I can be thankful for that up in here.
With this thing that happened to me, and I like submitted this, and anyways, the whole thing, and I literally thought about the Mandela effect, because I was like, is this fucking happening to me right now? I was like, this happened to me right now, because with all these grants, when you submit them to, like, basically you're, as a researcher, you're trying to get money, so you apply for these grants, and they're super, super anal about, like, you have 4 pages to write on this, 2 pages. Like if you go over like 1 line, like you're fucked. Like that's you can't. So weird. You got 4 pages, no more than 4, and your margins have to be, set margins, page sizes. It's all precise and it's all outlined, and you must follow those guidelines. And I had 2 pages for one of these sections that I had to do. I did 2 pages on it, and I knew it was 2 pages, and I made sure it was 2 pages, and then I submitted it, and then I looked at it later, and it was like 2.5 pages. I was like, what? I was like, I fucking know that this. I was like, I double checked this. I quadruple checked
weird.
this.
Somebody changed the font size.
I'm like, I was like, this has been tampered with, man. Like this isn't, and it was.
But no one would have had
shifted,
access.
and I'm like, no. And this was like days later, and it was just my like anal retentive brain is like, I'm gonna just go with like, let's have a look at it. Like I submitted it. Let's have a review over what I did and see how good I feel about it again. And then I got like so mad because like at myself basically. So I was like, wait. Like I didn't just totally screw myself, did I? Because I know I had 2 pages for this. I made it 2 pages. Now it's more than 2 pages. And I'm like, this isn't good because they could literally just throw out the whole thing like based on that. And I'm like, and I just couldn't understand. I was like, is this like a Mandela effect? And then I went back like a couple days later. I looked again. It was 2 pages. I'm like, what? So I was just, I'm still stumped. I don't understand what's going on.
And you only ever viewed it through the same medium?
Well, that's the thing. So when it was proofread by some staff that like work for our lab basically, and then I specifically emailed to them because actually I noticed they did it. They pulled it into Google Docs because there was a few staff that proofread it, and then there it was more than 2 pages. So I pulled it offline off Google Docs back to a Word doc. It was 2 pages. Then I sent it back to them to submit because they had to submit it for me. And then I told them, I was like, hey, I pulled it offline. I didn't do my editing on Google Docs because I noticed it changed margins, it changed fonts, something changed. So I pulled it back offline, sent it back to them. And then I looked at it through like the system viewer basically. And then I looked at it with the system viewer like through the email when you just like preview the doc. And then I looked at it again in my in my Word doc just on my computer, and it's like it had changed back and forth, and I knew I had different drafts.
So this could be a technical,
but I made sure that it was like so that's I guess where it comes down to for me for Mandela effects and things. It was like maybe there's just some technical glitchy bullshit that goes on.
Yeah,
that maybe you didn't notice.
I think well for sure when you go through the list of all of them that are out there now, there's a bunch of them that seem pretty explainable.
Did you see that one recently that came out about the? It was like. Well, their only conclusion was that like this guy who was doing a Mario episode, or like he was doing people who like do the like speed race through Mario, like trying to beat the game super fast, that he like ended up with some glitch that they said was like, they concluded at least that it seemed to be due to like a quantum level type glitch, that there was because there is like neutrinos and things passing through us all the time, that they're like, this could only have happened if he had like, if one bit in the game got flipped. So it was like a bit flip, I think they called it. So instead of a 0, it became a 1, or a 1 or a 0, that they said that got flipped, and then it got him this glitch to get through it. And then there was this big prize money that they put out that was like, if anybody can repeat this glitch, you'll win all this money. And then nobody could repeat the glitch, but then somebody basically programmed to see what happened. And then there was the way that the glitch occurred was through a flip of the bit in the game. So 1 became a 0, or a 0 became a 1 in one little place. And then he was able to get to this like slightly higher level because it changed the height of Mario by whatever tiny point.
Okay.
And then now so it seemed like the solution that the guy found was that, okay, this occurs if you flip this bit, but then there was no explanation for the guy who was doing it. It was like, well, why would that bit flip for me? And they literally, they interpreted it as from like a quantum level. They're like, oh, they must have like interacted with some
high energy particle.
Yeah, exactly. Some
That's
kind of neutrino
crazy.
solar flare or some shit. And
wow.
Yeah. I think from a psychological point of view, there's definitely got to be some Mandela explanations too. I bet there's got to be research.
There's
on
one about that movie. There was a movie that actually came out called Kazam with, what's his name?
Shazam.
Yeah, Shaq.
Right?
Thank you. And all these other people swear they've seen a movie called Shazam with Sinbad.
Yes.
And like they swear, even though that one seems like that's just your memory is not on.
I remember that movie with Sinbad. Yeah.
Well, there you go.
God. It doesn't exist.
Man.
The movie was Kazam with Shaq. And it was about a little boy finds a genie and all that. But some people remember. I
swear there's a Sinbad movie
called Shazam.
There you go.
Jesus, I got to go look that
That's so amazing.
That's unreal.
Oh, that makes me happy.
Super true.
I wanted to ask you, because I saw it again on the back of the book, and you're the CEO and director of the Canada Neuro Inc. Is that?
Yeah.
Okay, because it brought me to the link on your website was a 404.
Oh, really? What did you...
But then when I actually just typed it in, it brought me up.
Like through my LinkedIn maybe or something?
No, through the Matt Buchanan Studios. When I clicked the actual, there was like a text part you could click, and that brought me to a 404.
Oh, I should look into that.
Yeah. Sorry, that's what I meant. I thought it was error 404.
I know what you mean. Yeah,
computer lingo. I was trying to be cool.
I knew what you meant.
I don't know computers.
I maintain all those websites. I should probably look at that.
I'm glad
I haven't looked at that
if I brought that to your attention.
Yeah, thanks. I didn't realize that.
But I did find a website that seemed to be the same thing. It was a place located in Ottawa.
Yeah.
And they offer Neurosurance.
Neurosurance, yeah.
So insurance for your brain. Basically. And it was, again, a lot of athletes and military.
Yeah.
Different plans and stuff. Yeah. I just thought that was an interesting concept, insuring your brain. But it makes sense.
Yeah. Yeah, no, it's that's cool that you found that too, actually. Yeah, so that's www.canadaneuro.com. Yeah, I'm the founder and CEO of this company. It's a company I started a couple years ago toward the tail end of my PhD. So I had, I guess my plan A in exiting my PhD was get into an Ivy League school like Stanford so that I could come back and, you know, become a full professor out here. Or, you know, I applied to Harvard lots of times and I tried Oxford, and I you know, failure is a big part of my life, as it is for most. And the point is to just keep on doing it. You know, I didn't get into any of those, and I did get Stanford, so I'm super stoked on that. But one of the other like my plan B, I guess, which is still like a long-term plan for life, really is like something I'll work on for 10 years, was, this company called Canada Neuro. And that was like, okay, so once I'm done my PhD, I want to either get into one of these fellowship positions so that I can parlay that into like a full professorship, or go full-time for my company and then, you know, go the entrepreneur route and work through building a company that does this. And so basically, in short, it's like a private brain scanning company, because there's not really a lot of places you can do that in Canada, or in Ottawa especially. Well, I shouldn't say especially, because I guess in Ottawa there is a couple places here, and there's probably more in Ottawa than there is in most places in Canada. Like, you know, there is in like Toronto, Montreal. It's like a big city thing. But the goal was really, to be able to provide like private brain scanning to people who, I guess, have the means for that. But really our focus is on, at the moment, at least, on like military partners and athletes, pro athletes and amateur athletes. But the idea of Neurosurance was something I came up with a few years ago, which is like one of the problems with doing brain injury assessments is that patients will come into our clinic, like the clinic I worked at for many years, where we published that machine learning study on concussion, for instance, which is, I got a shout out for that clinic too. They're called the Seeker Center. They're not far. They're down on Maryville, and they're near the Royal and the Civic Hospital here.
Cool.
And that's where I developed a lot of these skills even more, was like learning about the industry side of all this, where I worked there for many years and then started my own company in a similar regard, but focused really on the athletes. So they're ultimately a chronic pain clinic, but they had a brain clinic there, so I was director of research and a manager of that brain clinic. And I sort of ran that clinic and all the brain stuff that they did, and then started developing a research program there. And what I realized was that one of the issues is these patients would come in from a car accident. We would scan their brain and then look at how we could fix it with like neuromodulation, brain stimulation, things like that. But one of the challenges of that is that we don't have a baseline to compare it to. So
pre-injury,
we don't know what your brain looked like before that. So, what we do is we would compare it to a healthy database, like a normative database of like 1,000 people who are all healthy, who have donated brain scans and things like that. And this is a database that exists from Russia, basically, and we leverage that database. If you come in with a brain injury, we take your brain scan, and we compare that brain scan to this normative database. Then we would see what's abnormal about your brain compared to all these healthy brains, and then we try to fix that. That's a good approach. It's currently like the best approach, except if accept what my company does now, which is we collect baselines for people who, pre-deployment for military, or we collect like a baseline at the beginning of a season.
People who have a high risk for incurring one of these injuries.
Yeah, exactly. If you are at high risk of maybe having a brain injury, come to our clinic, get a brain assessment, and then we don't charge you very much for that initial assessment. So basically, that's why it's like an insurance model. You basically just pay to like have your brain scanned, and then the insurance aspect is like, if you do incur a brain injury, then it's like you pay like a deductible kind of thing, where so you're not paying all this money unless you actually get injured. So, but the key factor is we already have a scan of your brain on file from the beginning of your season or before your deployment. So if you get a brain injury, then you can come back to our clinic. We have a brain scan to compare it to. We'll scan your brain again, and that brain scan we do like really quickly. So that's also part of our model, is like you can come in and like we guarantee that you'll get your brain scanned within like 24 to 48 hours after the injury, which also makes a difference, because sometimes the patients that would come to our clinic before in the previous model, like car accidents, they might not be coming to us until like months after until
there's some serious
sometimes longer, and then they see side effects. So we get you in right away. We can compare what your brain looks like, and then we'll even do follow-up care, and then you're only really getting charged if you get a brain injury. And it's not like, I mean, when you say it like that, it's like, oh, so you're like making these people pay who get injured. But no, the point is, if you've got a whole team of 30 people and we're going to charge you a certain value to get all 30 people scanned, we don't want to charge you the full value of the whole, because the real cost is actually in doing the interpretation. The scanning is expensive, but the part that's more expensive is having a professional doctor or neurologist, somebody interpret that scan and actually process all that data.
Yeah.
So basically we cut out that cost by saying we're not going to do all that unless you get an injury, because otherwise we don't really need to process it. We have it. It's always there. We can always process it.
The neurologist will love it if it's necessary.
Yeah. And then then if you get an injury, then we have your scan on file. Then you pay your deductible, basically. And that's why it's called Neurosurance, because it's kind of like an insurance model, so that we can better help you and help your brain. And we have a lot of research initiatives too. I created something called the Digital Brain Bank, which is this idea of, like, a lot of people are like organ donors. So, a lot of people, when they die, they're willing to donate their organs. But, like, why not donate a digital scan of your brain while you're alive? That could help lots of people as well. And it's something like a big data approach. So, like I talked about that normative database from Russia as like 1,000 scans. Like, my lifetime goal is I want to get like 100,000 scans. Like, I want to have like a population baseline, get hundreds of thousands, because there's some things you can only elucidate when you have big enough numbers.
Well, and wouldn't brains possibly be regionally specific in the way that, Asian people look different than black people, and there are physical differences between different people from different parts of the world. So I would imagine that might parlay into brain shape or size, or
I'm sure that there is in some ways, like the brain shape, size, the type of activity, and even just like mindset and cultural implications, genetic implications of like
dietary stuff might even affect
diet. Exactly. There's lots of things that could say why the people's brains in this particular like, for instance, a lot of like one of my PhD supervisors, he had a lot of research where he would have brain scans from people in Mexico, and they would do a lot of research on those brain scans related to pollution, because there's so much more pollution there than there is here. And there's not they're still very similar in so many ways to us. But one thing that we do know is that everybody from this particular region was exposed to high levels of pollution during childhood, for instance. Okay. So now we have a brain scan of them, and then we can compare it to people with brain scans in Canada where, pollution is not so bad. So there's all these environmental factors that could also definitely like influence.
It would be so beneficial to have like a large database everywhere and just keep adding to that.
So there's a lot of initiatives like that are going on where people will do that for different brain scans. Like, there's big MRI databases, EEG databases, but like the largest one that I'm aware of is only got, like thousands of brains. And so, we want to go bigger, basically. And, we're working with private partners and, different investors and things like that. And if you're one of those people and you're interested, feel free to reach out to us. And we do collaboration through universities, but as well as, like private partners and trying to build that database. And that's sort of one of our research initiatives. And then the more data you get, the better models you can make, like with machine learning techniques and creating like big, deep neural nets and stuff. Like, really, it's like you got to feed lots of data into those. And the more data you can feed into them, the better accuracy you can get, the more sophisticated they get, and the more like questions you can answer, basically. So you could kind of like query a database. So if you had thousands of people and you knew, these number of people all had depression and a brain injury, and then these people all had like PTSD, and then these all had this, and you can kind of start to parse those things out. But if you've only got like 10 or 50 of these, but then you compare that to somebody who had a database that had thousands of those, you get a lot more richness.
For sure. Wow. Man, that's so awesome. This has been so interesting, and thanks again for the book.
Yeah, you're very welcome.
I think it's brave and interesting and cool that you decided to, like, you've described this as artwork as well as obviously having a strong scientific edge. So I think that's cool because, not everyone would want to cross those boundaries, because some people might not like, people don't like it when you do stuff like that, and break the rules. I saw one guy on Amazon, your only negative review. Have you seen this?
No, I haven't.
He said that this was invisible sky god baloney, and he was like questioning your credentials and whether Amazon should even put this in the science category or whatever.
I have not seen that yet. No,
he sounded like a disgruntled gentleman.
That's funny. No, I mean, hey, it's bound to happen at some point. That's
your intelligence is very clear after even talking to you for a few minutes. So,
that's very
so
nice.
Fuck you, random Amazon guy.
Yeah, did he even leave a name? I mean, or is just out there hiding behind his...
I just saw it briefly.
Yeah.
I thought that was a funny
I don't check that all that often, but no, that's funny. That's the thing about art, it's only half yours, right?
Oh yeah, and all the other reviews were super positive. So
that's good.
Dad, do you have anything else related to science and all, and the book and all that before I move on to comedy? Because I know we've been going for a while, and
yeah, no, I'm good, but I would agree. This has been a fascinating discussion, and kudos to you for doing such an ambitious thing. I'm looking forward to reading it, and I'll get back to you on it.
Oh, thank you very much. I appreciate that. And it means a lot to have people read it. And I think, the way I approach it is from, a certain level. And I think that if you're not, there's a lot of people out there with different beliefs and different points of view. And if you don't agree with those things, maybe you're not going to like the book, and that's okay. On you, basically. Yeah. Maybe you won't like my comedy. Maybe you won't like a lot of things about me. And that's just, it is what it is for whoever you are. Like, a lot of people have different opinions, and that's what's cool. But like what you said, like Brave, like you doing this too. It's like you make this, you put this thing out there. I'm sure you get lots of great feedback, but the nature of even YouTube or like anywhere that has online reviews, you get lots of conflicting results of people who just like have nothing better to do with their time than to
well,
be
my
negative,
show doesn't have whopping viewership for the most part. When Spendy came on was probably the biggest, where it got in the thousands, and even then people were pretty nice. It was mainly really positive, reinforcing stuff. There was a few people saying that me vaping was a shitty host thing to do, and I'm like, fuck you, I created the show to be in an environment that makes me comfortable, just and chilling. I ask every guest beforehand if it would bother them, so shit like that. And when we had the plexiglass up when we didn't really know what to do during the pandemic, and Spendy just happened to I was just, they had them at the fucking bank at the liquor store, but some conspiracy guy's like, oh, it doesn't matter, and well,
there's always going to be somebody like that who just is talking bullshit. And
what was I gonna say? Shit. Oh yeah, well, let's move on to comedy, because I don't want to run out of time. And you are a funny dude. Even going to your website, mattbuchananstudios.com, you had a nice little compilation clips of you doing stand-up, and thanks, man. I was really laughing at a ton of stuff, man. Even but this kind of is the question I wanted to get to, is when you were like, say, doing your interview for Stanford, were you nervous about them finding your show with Jackie in episode 1, onesie with a dick sleeve, or you had a joke about having like a nice penis, and then it's because the lady at the STD clinic says like, oh, you have a sick penis, and you took it to be like sick, man. But yeah, anyways, so were you like, a little apprehensive or nervous about them, or did you want to say, hey, this is me, take it or leave it?
No, 100% was not hoping they wouldn't find it necessarily, I guess, which is,
well, it's not hidden very well in that sense.
Yeah, like it's out there on the internet. The only thing that really discriminates between the two is just the name searches. Like if you search only Matt Buchanan, you'll mainly find that. If you use my first name, it's a little less down the Google line, I guess. Like if you spend 10 minutes, you can find it, I'm sure.
Well, and also if you got the book, then you're going to be linked to it that way.
Yeah, exactly. There is some cross promotion, and I think I'm going to get over that type of apprehensiveness eventually. Like it's always just like a little bit of like imposter syndrome, I guess, too, where it's like I am worried for myself that it's like I don't want to compromise these scientific aspects of my career just because I like comedy and stuff. And I don't think that it would necessarily be interpreted that way by a lot of people. And maybe I could have been outright with it, but I was told actually like many years ago, because I started doing comedy when I was like 19 or so, maybe like almost 10 years ago at this point. I was like 19, 20. And at one point I had put, because I won a Yuck Yucks competition in 2013 in the GTA. Oh, cool. And I used to have that on my resume. But 2013, I didn't have a lot of academic stuff on my resume either. I had like maybe one academic type job that I worked. And then I had that on there, and I remember applying for some stuff and like getting feedback that they're like, you should just take that off. They're like, it's not relevant, like it's interesting. They also told me for other stuff too. Like I'd submitted some like photography and had photography featured in some like showcases, and they're like, yeah, get rid of that too, it's not relevant. Like,
both of those seem so weird to me, and like places I wouldn't want to work. I even actually once I contacted a guy who was like a president of a decent sized board game company, still up and coming or whatever, and I just through talking to him kind of introduced myself a bit, and he ended up like offering me like it was sort of like a job interview. He didn't have a job to offer at the moment, but he was really drawn in partially by the fact that I said I did dabbled in stand-up or whatever.
Right.
And I think that makes sense though, because you're going to assume about that person that they're not maybe intimidated easily, that they aren't afraid of people or social environments, because you kind of have to get over that to go and stand in front of a bunch of people.
Yeah.
So, and similarly with photography, like anything where you're taking that you need a keen eye for and an attention to detail. These are all useful things in any workforce, in my opinion, but.
No, I mean, that's a nice take on
digress.
it. No, I think that's a good take on it. I think a lot of my friends have told me that it's silly to feel that way, or like, I would, not to take it that way, that of course it seems like it would add dimensionality to my resume and like things like that, and that it would make me seem more interesting, I guess. But I guess I've just took it from the point of view. I mean, like, look, we've been all across the spectrum of like a book and my company and the work and the research, that like there are enough things that when I'm doing interviews for these places, I'm like, look, I don't need to. I'll keep it focused on the shit that they care about that's relevant to them, because I feel like I have enough stuff to say in that regard that I don't even need to get into the other stuff. But at the same time, I was like, you asked, like, was I worried? I was kind of like, I don't think I do any comedy that's like too offensive or anything. But I mean, it's really just the shitty age of like cancel culture and stuff, where people would be like, oh man, if you're even going to talk about something like onesie with a dick sleeve, or like, you even say things like that, then it's like, how could we, we can't have you on our team or something. But like,
well, and to be fair, not everyone is in the position where they're going to Stanford. Like the expectations are a little higher, and I can respect that,
And maybe they'll be totally cool with it. I think like once I'm out there, and I'm probably going to do comedy in San Francisco, and like try to get comedy out in California, and like get into all that. Like I'd be very excited to do that, and maybe at that point, like I bring it up. I'll talk about the fact that I maybe do comedy. But it wasn't something I wanted to bring up right away, because I get concerned. I'm like, oh, I hope it doesn't like preclude me from getting this other position or something, or somehow interfere.
Yeah, this is why I don't think I would generally be great in a lot of sort of official type jobs or whatever you want to call it, because I feel like I find it so hypocritical how there's this veneer of like, ooh, we're so professional and everything has to be so blah blah blah, but everybody's still just people. Everyone still shits. Everyone still is horny. Everyone, you know what I mean? And I hate when people try to take that away and pretend it's not there and put this layer of like business blah, 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 shit on top, because I just feel like it's so easy to see right through it, and then I'm not taking anyone seriously, and then I just feel like everyone's full of shit. And I don't like being in that kind of an environment, as opposed to maybe a little more chaotic where people are a little, no filter or whatever. Maybe why I don't mind comedy clubs.
No, I mean, that's why I love the clubs. I love doing comedy for those reasons. Like everybody is chill in like a different way. And so far, for like, all the people I've known at Stanford, and like even like my current like bosses through my PhD, like nobody's really taken aback by the fact that I do comedy yet. So I don't really have much good evidence for reasons to hide it even.
Well, that's the other
side
of it.
It's just like a personal thing of like, I don't want it to interfere, and that would really suck if it did. And
it's not how you lead into it.
Did, but it's
no, that's the other side of it. Is it's so great when you make an expectation that someone's going to judge you for something, and then they're like, "No, man, I smoke." Those are the best moments.
That is too.
The principal's like selling you weed or something.
A real relief. Yeah.
I don't know if that's ever happened to anyone. That would be epic, actually. If you were buying weed from your principal, you're like, the coolest kid in high school.
I think one day too, like now that I've kind of made it this far, and that like eventually, I'm hoping that sort of sensation will go away eventually, where it's like, okay, I've made it enough where like they can't, they're not going to deny me for this just because I have that, because I've already got.
Or at some point, if they hadn't noticed for long enough, it could be hopefully grandfathered in as like, hey, I never tried to hide this. You guys didn't notice. Now you're going to bring it up 15 years later. Like,
exactly.
It's like some statute of limitations on that shit. Okay, well, let's talk about the show you did with Jackie, because Jackie Graham, she's really awesome. I always end up on shows with her, and the last two shows, I think were back to back pretty much in a week, and she was annoyed the second time because I can't not do it. I especially now, because I try not to smoke before shows. But the second I finish my set, I go downstairs and smoke a joint. Okay. I don't care who's going up. And both times we did shows together, she went up right after me. So she was like,
missed her.
And I was like, yo, it's not personal at all. This is just a ritual,
This is a set I can
I'm OCD, but I have seen her perform before, and she is really, really funny. And you guys do like I want to say it's almost like a YMH, your mom's house type of vibe,
Yeah,
which
yeah.
doesn't surprise me with Jackie being involved.
Yeah.
I know how big of a fan she is of that. So it's you guys watching kind of interesting or hilarious internet clips and, you know, just talking about it.
And just shooting the shit on it. That's basically it. Yeah, it was my approach at like, okay, it's the pandemic. I'd started a podcast like the year before, kind of in January 2020, which was like more like an interview style where I was trying to meet mostly with like comedians or producers, musicians, music producers, that sort of thing. And like, I mean, a lot of what you've managed to like grow and continue doing here for so long. And then basically the pandemic started, you know, February, March 2020. So like I had done, I think 6 episodes of that, 6 or 7 episodes right until the pandemic started. Then the pandemic started and I basically just stopped altogether because I didn't want to do the Zoom transition. And I had lots of other stuff going on, but I was like, okay, I guess that's it for now. And then almost a year went by. And then there was still a pandemic. And I was like, okay, this isn't going anywhere anytime soon. I wasn't able to do comedy either because like stand-up was pretty gone. Like, I mean, I had a few shows, exactly,
bursts,
like on and off when they're like, okay, we can do like 25 people or whatever. And so I was like, well, how can I keep doing comedy in the midst of the pandemic? And then also the interviewing stuff, as you would know firsthand, like became difficult because then you have to have guests in or you're doing Zoom or something. And so it's like, well, how do I get guests? And so I was like, well, if I start a podcast with just a co-host, then it's just the two of us. Like we can still kind of be like COVID responsible. And, you know, we only met when we could. And it was only just like my producer who also sat behind like a plexiglass screen and everything too, and far enough away. So like, that was safe. And then it was just Jackie and I, and that was it. And we did episodes like every week. And I approached it like let's do a 10 episode series. And that was called No Offense. That was it. And
sorry, I should have said that.
We planned to do more seasons, but then I got this Stanford thing. And so like, I think we finished our first season in like May sometime, something like that. And then we were going to take like a month break basically, and then come back, do a season 2. And I got this position and it just really consumed all my time dealing with that and moving and so much else. And so she's bummed. I'm bummed too. I mean, it's sad to see it go, but it was a really fun time. Like it was so much fun. And
people can check it out on YouTube.
Yeah, it is on YouTube. It's pretty, I think it's on like the video stuff's all on YouTube. And then there's the audio is also out there on most platforms like I don't know, Spotify. I know you guys did
Apple do one dating sketch thing too that went up.
Yeah.
Too long ago.
So once I found out that we were, I kind of always wanted to get into acting, honestly, and I thought it'd be fun to try some type of acting stuff or doing like some sketch comedy, basically. Because then it was like, okay, we can't. Well, season 2, we'd actually planned to basically include like a short sketch in each. So that one of the reasons why we wanted to do it by season is also so we could kind of change certain things about each season and like add new stuff. And because then, you know, it's still like the same show, but we could do some things differently. And so season 2, we were going to add like a short sketch each episode, or have like guests that were, because it was just the two of us as a co-host. We didn't have interviews or guests, but we're thinking maybe we could include some guests.
That would be fun.
But the guests could come in like a cameo type thing where we do like a sketch together or something, and then we include that, and then we actually talk about the sketches. So we started filming some sketches for that, and then we didn't end up doing the season, and so we were like, well, let's just release. So we actually have a couple unreleased sketches still that we were going to put out between the two of us, that I just still need to like edit them all together, basically. And we had a producer who did all the production work, but I did all the editing work, and so that was just like, it's a lot, you know.
I know.
And you know firsthand how. So it's like it's
there's a learning curve, at least, is the main thing I would say to people. But once you get better for sure.
Yeah.
Like I know how to make things happen now that I didn't even 6 months or a year ago. You know, I'm constantly speeding up the process.
And you're like 60, 70 episodes in or something, right?
But we're only about to end the second season, which each season's been a year around. So October 21st will be the marker of 2 years since I launched.
Congratulations.
Thank you.
No, this is amazing. You've really grown like a lot of this show here, and what you've done, I think, to help represent, you know, what's going on in Ottawa, the comedians, other people, like, and outside of Ottawa too. I know you've got a lot of other people. Like, it's pretty awesome what you put together here, and it's definitely growing. And thanks, man. I know you said earlier, you know, like the viewership is, you know, it's not always quite there, but I think that's what's sick about doing these is like you're building the catalog, though, right? Like the catalog's there. Maybe
you reach
even
people through different ways.
Yeah, I mean, you could pop off more in 2 years, 3 years, even more. And then all of a sudden, maybe you got hundreds of thousands of listeners that are going back 3 years to listen to all your original stuff too. And like, that's what's I love about making art and making things is like,
Definitely.
it's
It's
always
archived.
there. Yeah.
Yeah, no, I honestly cannot see any reasonable explanation for why I would stop doing this. It brings me a lot of joy. I keep learning stuff, making new friends, and anything else that comes along with that is just gravy. And my dad and me hang out way more than
That's
we used
super
to.
cool. Yeah.
and I love hearing my dad's input on all these conversations too. So, but yeah, shout out to Jackie. She's supposed to come play board games sometime soon because she's really into them too. So
Nice.
And
Yeah,
actually, speaking of that, if you could touch on this on your website, it looked like you were designing a board game or something.
I did. Yeah, actually.
It was like a prototype or something.
Yeah. So I made a board game in 2019.
Because I will say I wasn't on Board Game Geek, the true mark of a board game.
Yeah. I should have. Well, if I had more, actually, I could have brought you one of those. I forgot that. Yeah, you're like super into board games too.
Man.
We could play. It's like a deep strategy game.
Abstract?
And, I don't know how.
Well, abstract is like chess, or like there's no real thematics.
Yeah.
Like, there's no storyline.
Chess oriented. Yeah. That was actually sort of like, it wasn't meant to be like chess, but the premise was meant to be oriented like chess in the sense that everybody in the game, like you all start off with like the same pieces, the same probability of winning, basically. It's like you all have the same
symmetrical
moves,
game.
and then it's really just deep strategy of how do you symmetrical. That's a good way to put it. And
Well, because asymmetrical games are a huge board game hit. Most of our games, it's where like you're playing this guy, I'm playing this guy, and we are operating under a set of parameters, but your deck is full of totally different tricks and things you can do that I cannot, and vice versa.
Gotcha.
You know?
Yeah, okay. Like if you're, or I guess would you classify that like, maybe not as like a board game, but I guess like if you're playing Pokemon cards versus each other, or like a Magic or some card game like that.
Yeah, I would. I mean, I guess because you're deck building, you're customizing your deck. So yeah, as long as you're not playing the exact same thing as the opponent, then it's an asymmetrical.
Gotcha.
That can vary to different extremes, of course. But I will give a shout out to Unmatched because I interviewed actually the president of the company that makes that game. But you can fight Bruce Lee versus Deadpool versus Sherlock Holmes versus whoever. You just pick a guy, grab their deck, and play in like 20 minutes.
Sick.
Yeah, it's a really great game.
So yeah, I made this board game. That was it.
What's it called again?
It's called 33 Degrees of Order and Chaos.
Okay.
And the premise is that it's just kind of like a chaotic strategy game and winning points and different things. And this was one of those weird things that happens to me with some of, I guess, different things that I make or end up doing that I do a lot in my head, I guess. And I do a lot, like I like whiteboard work too, and writing things down, but I really like to like move things around and characterize and do stuff in my head. And I had this idea that I wanted to make a game at some point, and I really wanted to come up with like a game that I could make out of a deck of cards, like a standard deck of cards basically. That it's like, how could I come up with like my own game with a deck of cards? And so it does use 2 decks of cards, but there's also like chips and pieces involved, and there is a board, like game mat for it. And then I started thinking about it one day when I like woke up, and then I had a lot of ideas of how they could work. And this was around like Christmas 2019. And then I was driving home like near Toronto from Ottawa. So it was like a 4-ish hour drive on Christmas that year. And I basically designed the whole game in my head on that drive. Wow. And I was just driving, and I was like, gave my head something to do while I was driving, and I was like, this is cool. And then on the drive home back to Ottawa, I kind of finished designing the game in my head, and then I was like, fuck, now I gotta make it. That's how my brain goes, and that's what it is like I do things, and that's why I'm fucking all over the map with my career. My life is like, because I think about something, and that's to me what to bring it full circle, that to me is the meaning of life. You want to do something and then go and do it. There's too many people that don't do the things they want to do because they're, whatever reason, you're scared. It's fine. There's lots of apprehension. I get that all the time too, but it's like, when I want to do something, I just literally go and do it. I don't ask permission. I just do it. And since I'm like, well, how do I do that? And so I started working with Game Crafter. It's like a board game manufacturer where you can kind of like make your own games.
For customizing.
Exactly. Yeah. So I've made some, like you said, like prototypes, and then it took me a little while to like get all that work done in terms of the artwork, and then I've made a few. So I have like a few physical copies, like fully built games, maybe like 5 of them, and then I have purchased all the stuff to actually make, I think like 40 or 50 games that I was going to start selling. But that was, like I said, Christmas 2019. And then in February 2020, I decided I wanted to write this book. And then I started writing the book.
Got sidetracked.
And then I got very sidetracked and finished the book first. And that became more important at the time. And it's definitely on my list. Like I've always got a list of projects and like just things that I'm toying around
Yeah, how much
with.
play testing did it get?
So far I've played it with only like a few people. I mean, it's actually shameful to say that I think I made the first game and I had it probably finished and made for months before it even got played. And I was like,
that's
man.
not really the problem so much as, especially for someone with, we're talking about rigorous science and all that.
Yeah.
I've always heard playtesting is like the most important part of designing a board game. So
Yeah. So I've probably played it maybe only like half a dozen times even up until then. And there was a number, at least a good handful of things that came up that I'm like, okay, I need to, there's a lot I can figure out in my head, but then I was like, no, I do need to play test it because I needed like, okay, if there's any like contraindications, basically like, oh, you can't do that if you can do that, or like the way the rules work, and to make it work. And so that's kind of actually the point where I'm at now is I need to update the rule book with the new rules that I've realized through playtesting, because I'm like, okay, like I need to have a rule for that, because when you're playing the game and you're like, okay, well, what happens when this happens?
sometimes you can
like,
break
oh,
the
shit.
game,
Like,
or it
exactly,
makes a rule so that it's like,
You
we
reach-
have to stop, or no one can win. Or,
you reach some impasse, or you're like,
Yes,
there
exactly.
was no rule for this scenario. So it's like you got to think of all those scenarios, or you have to play it enough that you find all those scenarios. So it's definitely not perfect yet. Still needs some work, but I think the concept's there, and it's something that again I hope to put to market eventually. And
Still
I
very
have
cool.
some friends who have had their board games bought like by big companies, and honestly, it's kind of like maybe something like that where it's if I can do that, get it made, build some following or market for it, and then maybe some big company will buy it or
See,
something.
it's a dream of mine in my lifetime to produce and create a board game and put it out.
Nice.
And my problem is more that I'm always the idea guy. I'm so good at coming up with thematic concepts, even general gameplay mechanics concepts, but I get so sidetracked when it comes to the mathematical probabilities and then just a lot of the other things that need to go into making a board game. So I feel need to partner up with the right people that fill those other archetypes or whatever you want to call it, and I could have something really good, because I've got a couple games I don't want to talk about because I think they're thematically really cool, and I don't want someone else to jack them
Steal 'em.
potentially.
No, that's insightful though, man. It's good to know what your strengths are and to know like to work with other people to get that shit going. And
It's easier said than done, when you've already got a bunch of shit going on. But what else was I going to ask you about? No, I think we got there.
I mean, you got a comprehensive list there. I think you covered a lot more of the map than I even expected. I had no idea really what to expect. I knew you would have some things prepped and some questions, and like
I always
some
try to
background,
have.
but
I've learned in the
was
past.
very thorough, man.
Yeah, you never want to have too little, so always have too much, and especially because sometimes even still, I find myself making a notes list that I'm trying to put in somewhat of a chronological conversation order that I think it's going to unfold, or I may even try to guide it through. But sometimes it gets unraveled in the first 5 minutes, and the person jumps from like all 5 topics, and I'm like, all right, we're just gonna have to freeball this one,
No, I was happy to let you take the lead on this. I was a little worried. I was like, fuck, I don't want to be like that guy hijacking shit, because I'm used to hosting with my show. And I was like, I mean, I definitely think I talked a lot, but
that's okay, because you were explaining a lot, and there was a lot of stuff that I don't know that I could have added much to. I was just kind of much like our last episode with the chef we had on, because I was in awe of a lot of what she was saying. It was very interesting, but I didn't always have a lot of feedback, and I got a little self-conscious about maybe I'm not hosting good at that moment, but that's cool, because the audience might feel the same way. They might be just as lost as I am, or just as much of a novice in these categories. It's probably getting late too. I know. Oh yeah, I know that. I had debated bringing up stock markets because I had heard you, or I read somewhere you were pretty into stocks, and my dad's into crypto right now. Which, you want to talk crypto? Because my dad's. You don't mind talking about that stuff? I find it pretty interesting.
Yeah, I'm not way into it. I put my toe in the lake kind of thing,
and
got
some funds.
I got some
right now.
solid return on nothing invested. So I had a thing where this one crypto, like you play a game sort of to mine it, right?
Yeah.
So I'm doing that, but I did it way back at the beginning when it was just getting started a couple of years ago, and for a long time it took me like a year and 3/4 to get to sort of 200 US that I mined, right? And one day I woke up and it was 2,000 US, and then a little while later, one day it was 20,000 US, and it's popping right now. So I'm I don't even know how to. I don't even know the steps fully in the process to cash it out. You got to go like through these different agencies to convert it to Ethereum, and then get Ethereum to US dollars, get it from there into a bank account. Like but it's a fascinating area, and I have no doubt that crypto is going to be a big part of the future. And stop fighting it, people, and start reading about it and learning about it, because one day it's going to be all digital everything, and 100%. It's just the way we're going.
But for the last little while I've been talking to him, he's definitely been letting it ride. Yeah. And it seems to be, keep going.
Well, no, it went up to like the equivalent of about 50K Canadian, and now it's slid back to about 30K. So
yeah, but what was this
going to do that
initial investment for you? He got it super
like $100.
Yeah.
That's amazing.
Yeah, I just got it.
Fuck. Crazy. I think you're in the position that most people wish they were in for crypto. And like, I personally don't hold any crypto at the moment, not because I don't believe in it, but just because I dabbled a lot in stocks and was mostly just focused on stocks for a while, and then did really well for a while, and then did very poorly for a while. And that's just the way it goes with stocks. And then basically it consumed too much of my time, because I would found that I'd be like, just like checking it every 10 minutes, like watching, because I was doing day trading basically, like, and flipping like penny stocks and stuff like that. So it's the kind of thing that where you basically, like, it's not a long-term investment. You have to like get in and get out as you get something. While it's like companies that are like really, really down in a really bad time, and then hope that there's some indicators that is going to pop them up. And so it took way too much. And so for the last few years, I've only been doing like long-term stuff. So it's something I'd like to get back into, but I'm like a bit apprehensive.
Sounds stressful.
And it was too stressful.
Well, and that's the world of regulated stock markets and things. Crypto's like the friggin' Wild West big time, crazy. Right? I mean, you talk about vaporware and software. You have vapor products in crypto all the time. You have these initial coin offerings, and people are come up with these wacky ideas, and people just sometimes I don't go, why would you buy that, right? But people do, because they're trying to get into it, and it's just crazy though right now. Yeah.
Well, that's the thing. I think there's a lot of like coins to be cautious of. Like I agree for sure. Cryptocurrency is the future. It's going to eventually replace a lot of banking, I'm sure, and like it's one of those things that you see the early side of it now. People probably wish they were in early, but it's like, only there's a lot of coins that emerge that are just emerging because crypto's popping, so people are buying into them. So what I've been told, at least, like I have friends who are pretty heavily invested in things like Bitcoin, Ethereum, that it's like try to invest in coins that actually have like a real use, like a use case, like Ethereum does, like Bitcoin does, like Ripple does, for instance, and then look at what the team is behind the coin, as far as that is.
It's a lot of research, though, man. I mean, you talk about a time eater. It's one thing because you're checking it because something's popping, but it's another thing to go, well, who owns this company and what's the background and all this kind of stuff. And you can just while away the hours and still make a big mistake. And when you've got an environment where, you got a thing called Dogecoin, and you get Musk makes a comment and suddenly it's through the roof, and you're going, okay, do I really want to be in on this? It's
super volatile. That's the nature of the crypto, though. I guess, well, like you've got it perfect there, of the fact that you were able to like mine. Like the mining is a whole other side of crypto too, which is interesting. The fact that you can basically like earn this digital type currency, and then like you also mentioned cashing it out. Like they don't make that easy either. But the fact that you can do that, and the fact that a lot of coins, as far as like money goes, I guess, like if you were to translate it to like terms of US dollar, Canadian dollar, might start out at like 0.0001 or something. So then that's kind of where I came at it from the point of view of penny stocks too, is like if you buy a stock that's like literally worth like 2 cents, but you buy 1,000 of them, that only costs you what was that, like $20 or something, right? And then but that coin then goes up, to 4 cents. You doubled your money just from going to 2 to 4 cents. And it's like that with crypto. It's like if you got a coin that's like 0.0001 cents, and then it goes up to even being worth half a penny, you just went up like 500x. You're like, and whatever amount money you put into that is massive. It just blows up.
But it's like day trading too, that there's some sentiment that gets with a coin and suddenly it starts rocketing. And you don't know if there's anything solid there or it's all just crowd enthusiasm and something pops so that you get some heavy whale in there and he suddenly sells off and suddenly it just changes just as fast the other direction. I mean, just like real stocks sometimes, right?
That's how I got screwed basically, was that it was like back when weed stocks were big, and when
I know a guy who got screwed with that too.
Yeah, like I did, like I said, very well for a while and then not so well for a while. And thankfully, most of what I lost was stuff that wasn't even my initial investment. It was like money I made. So it's like, okay, in the span of, a number of months, you're up like 20, 30K, and then you end up losing most of that because you just like do one wrong thing or you stay in too long, and it's like,
it's all when the hype dies down on certain things.
Well, it's like what people say with that and with gambling and everything else. If you get your initial stake back out, then you can actually say, well, this is money I never had anyway, and if I lose it all, you know what? I'm no worse off.
That's kind of how I ended up leaving happily, I guess, with it. It was like, hey, at least I didn't really lose money I didn't have. And it did give me some insight too into just like realizing, even at that, how good off I have it. Like I could lose everything that I have and I would still be better off than so many people in the world. Like you could take everything away from me, everything that I own, all my money. You could take my house, all my belongings, and I'd still be better
a white
off
dude
than a
in
lot
North
of people.
America.
Plus you also get some, I think going through the whole thing, you get some insights into yourself. Like how susceptible am I to greed?
There's a lot to learn, like you said too, just from the point of view of understanding the economy. Like, have you ever heard of? There's a great book, and there's also an audiobook version of it called "The Creature of Jekyll Island." It's all about how the Federal Reserve was created, and I guess you could. I don't want to use the term conspiracy because it's the negative connotation of it, but it's like it basically, some people would view it as like all the like money related and gold related, like how that began in the different banks and how all those banks started early on. And
I've heard about the Federal Reserve and emerged, how fucked it is,
and all the different ways basically that they can create money. It's a super comprehensive book, and they go through all these like really nitty gritty things, and I find it fascinating conversation about how that came together, and the way that they control gold and all the other ways that they can like tax and basically make money, and then kept the banks kind of working together. And it's all like, the Rothschild Rockefeller type stuff. Yeah, exactly.
Sometimes even now I think the world of high finance, the world of currency, it's this thing that the only way it can keep going is that we all collectively are believing in it. Because these guys they're just printing money as they need for whatever, and it's all owed to somebody around, trillions are owed, but it just keeps going up. But who's it owed to? It's just, you get into this stuff with the states and China, like who owns most of the state's debt, right? It's China, they say. Also, are these guys ever really going to fight it out? If China wipes out the U.S., they never get their money back. You know what I mean? It's like, come on.
Yeah, no, that's funny, man. It's that is exactly how it is, and it's like the history of money and how it emerged. I talk a little bit about that in my book too, of like how trade began, and money used to have a physical representation. You get paid in livestock, for instance. Like I'll give you 6 goats, and that has value, or you give somebody gold, which has a value and has a weight to it, and but now the whole Federal Reserve thing is that there's not as much gold as they say that there is, and with the same thing with banks. Like banks are only required to keep like 1% of what they actually have in liquid cash. So the other 99% of that they can loan out and then tax the loans, and then they can, or rather collect interest on the loans, and then you can collect interest on the interest, and so on and so forth. So that if everybody wanted to take their money out at the same time, there wouldn't be enough money in the bank, and that's kind of what causes banks to crash and different things, the housing market when all that blew up, and that there was all these subprime loans. So the people who they were giving loans out to all these people who actually couldn't pay their loans back. So then enough people couldn't pay them back. So then the banks crashed. The banks had to get bailout. That was like 2008 stock market crash and the housing bust. And so I was like, I like to learn about that sort of stuff, history of money, and super interesting. It's kind of what drives the economy. And that's one of the reasons why I guess cryptocurrency is proposed to be this big solution potentially, because it's like a decentralized source where when you have a banking institution or a Federal Reserve, like one company of the country who runs all the money, that's a very centralized banking system. It all flows through them, but cryptocurrency is decentralized. Everybody owns what everybody owns. And
you've also you've got the blockchain, right? This inviolate tracking mechanism that is unbreakable, so they say. So
yeah, that's
I wanted to speak to what you said about if China took out the states, they'd never get their money. If we look at the mafia, they don't kill the people that owe the money; they break their toes, break their fingers. So that's I think what would happen there. They'll try and strong arm them. Because it's a good point. If you take out the person that's your source or whatever they might be to you.
Well, they're also their biggest customer and things like that, right? I mean, it's just there are so many interconnections at so many levels that, I mean, it'd be the end of the world really if these guys went at it, because we'd have a worldwide collapse of like everything. So.
Yeah, and that's all for this week, folks. We always like to leave on a positive note.
Yeah,
we should wrap it up, though, but I want to ask you the season 2 question. If you could have dinner with anyone that you've never met before, who's alive or dead, who would it be and why?
Leonardo da Vinci.
Okay.
Yeah, he's my
Seems
favorite.
fitting for you.
Yeah, he's my favorite scholar, luminary of them all. Like he was an inventor, an artist, a scientist. I have a lot of like old journals. I wish they were real journals of his, but they're like copies, obviously.
Facsimiles, yeah.
Yeah, but that I love to read and like look at his sketches and his drawings, and like I just think he'd be such an interesting guy, and like the people that he worked with, and he was also very involved with money in the Medicis and the Medici Bank, and it was like 1400s ish or so. He just had his 500th year anniversary a couple years ago of his life or death, basically. 500 years past. So I guess, I think he was like late 1500s when he died. And I've always thought that, I don't know, I've always been fascinated by him. Like I think, if I were to have a top 3, it'd also probably be like somebody like Stephen Hawking or Einstein. Just super, super smart people, which is why I'm fascinated with people like Elon Musk nowadays, and like Neil deGrasse Tyson and stuff. Like, really though, just because like to me, like those are probably a couple of the smartest people like alive today, like that are existing, and like watching people like Elon Musk do what he does, and not saying he's all good and everything, and there's lots of reasons to like him or not like him, but he's fucking smart as hell. Like he can do all the stuff that he talks about too, like he is the engineer, he's the scientist, he's a rocket engineer.
He sends a fucking car to space on his rocket or whatever.
It's nuts.
When I saw that was kind of what pushed me over the edge with him, where I was like, okay, like that's a pretty baller move, I guess. I don't know what's cool in space world, but it seemed pretty rad to send a convertible or whatever it was.
I think it'd be cool to hear Da Vinci's take on like the world today, because I think if he was alive today, or if he was somebody who was like born today and then he like grew up in today's times, that he would still be like this amazingly smart like invention type person. But like the amount of things that he came up with.
What if?
Well, he was like the original Renaissance man before the Renaissance, right? And today I think a man like him would be challenged, as we all are today, because it's very difficult to be a Renaissance person today. There's too much knowledge. It's expanding too quickly. Everyone specializes because that's the only way you're going to get ahead in your particular field. In fact, you're a little more diverse than you're a bit of a Renaissance guy, if I may say. You don't get enough of that.
Flattering.
His ears are burning.
You don't get enough of that today. You get scientists, and they eat, live, and breathe their science, their discipline, to the exclusion of all else, usually, or in many cases.
Oh, you're totally right.
But it's hard not to do that, because there's so much data available just in your particular area, and it's moving so fast. So I think someone like Leonardo, who paints one day, does aerodynamics another day, and does sculpture a day after that, he'd be pushed today, I think, to live that type of lifestyle.
Well, yeah, it's so true when you're talking about there being so much data in a specific field. Like I always think that when I see, stumble on some random thing on the Nature Channel, and it's like Dwayne Elby, newt specialist or something like that. I'm like, this guy just studies newts, and then you find out there's like 65 varieties of newts, or probably more than that.
And he only deals with the purple
one
ones.
kind. Okay, we'll leave it on purple newts. That's a good one, man.
Purple newts, man.
High fives.
Fucking love it, man. I really appreciate
No, thank you for stopping by.
Awesome.
And when you're back in Ottawa, I'm hoping we can grab a beer.
Actually, yeah, man, that'd be great. And I was actually, I mean, you said it earlier. I don't know if I seconded it enough. Shout out to Jackie too in our show and what she has done. And even when you invited me to do this, I knew there'd be lots for us to talk about, but I half wanted to say, oh man, I should come in with Jackie and get the two of us in here and do like, just, I mean, her and I riff together well. And I'm sure the three of us, it would have definitely been a more of a comedy podcast today than I think I had a fantastic time talking with you about all this stuff, but I think that
I wanted to touch on both for sure.
No,
and then
great.
I picture if she had come, then she would be sitting there with maybe not that much to say as I am during those types of topics.
But, it'd be fun to have all three of us in here sometime.
Yeah, well, it's definitely something we can do in the future. I've thought that though, because there's several people where I've been tempted to say like, hey, would you guys want to come on together? But I also never want to make someone feel like they're not enough on their own.
True.
Yeah,
that's a very fair point.
Like we've only really used the double mic thing, I guess, the once so far, right?
Have you?
Yeah, we had two guys from, they do a magic show on Netflix, Big Trick Energy.
Yeah.
So two of those guys came on and it was fun. It was an interesting experience. In a couple of weeks, a few weeks, I guess, early October, I'm interviewing these guys from a funk band that I ran into locally playing like a backyard show.
Right on.
So two of them are coming for that. But anyways, man, thank you so much. Man. And all the best on your travels.
Appreciate it.
And at Stanford and all that. And thank you everybody for watching.